grow their businesses. So I advise you, our booth is behind. When you go behind, you just look for the shelf life booth over there. And I can assure you that when you come, we have juicy gifts for you. And then when you sign up and go through our services, you'll be very much acclimated with it. And I'm very, very sure, I'm confident and I'm assured that you would love it. And it will serve you well. We are already empowering thousands. We have over 1,800 pharmacists, community pharmacists onboarded. We have allotted over 1.2 billion naira in credit, and we have a reorder rate of over 80% within 3 months. I mean, those are good numbers. These are on our incredible numbers. Why managed credit is different, why it's better. It's not a loan, it's a growth tool, as is stated there. It's sales-based growth. As you sell, you pay back. So it's not like we are just giving you a loan and giving you interest on top of it. There's no interest on top of what Shelf Life is offering. We are just giving you a loan, and we are giving you credit rather, and then you buy, you pay at no added cost. It is we have flexible payment schedules rather. So like I said before, it's split into 4, 6, or 8 weeks, and then you can pay however you want, as long as you pay within the allotted period. And then there's no collateral required. We just run a credit check and we give you credit. And as you grow, as your pharmacy grows, we grow your credit with you. And lastly, there is no complex paperwork. There is actually no complex paperwork. You just provide what we ask you to provide, some of your details like I mentioned earlier, and we move from there. We are here to make you fly. What's in it for you at the conference here? Like I said before, you go to our booth over there. We have free business credit check at our booth to ascertain your credit worthiness and also to give you a sense of if your details have ever been used by someone else to borrow a loan or something from loan apps. Instant sign-up and product demo. A 10,000 naira credit bonus for every successful referral. Every successful referral means that if you refer someone to us and they buy products from us and we supply the products, we give you 10,000 naira with which you can buy more products, which would even make even more money for you. Yes. Also, we have premium branded pharmacy merchandise at our booth that we can give to you when you come to register. So I implore you, take a hold of this sweet and ample opportunity. It's pharmacy-oriented, it's sales-oriented, and I can assure you that it will give you everything that you need. Are you ready to transform your pharmacy? Meet us to get started. Thank you very much.
Thank you. Thank you, Shelf Life. So the solution that Shelf Life has will help us to achieve the theme of our program, of our conference, Technology Integration and Personalized Care. That's the future of community pharmacy practice. So if you've not taken on their product, please do well to download the app and set it up for your pharmacy. Up next, we have a panel discussion coming up now. And the topic for the discussion is show up or shut down. Why digital visibility is the new lifeline for pharmacies. This panel discussion is going to be handled by Drugs Talk eHub. Are you going to show up or shut down? I choose to show up. Can we have Drugs Talk? You go and start talking while this.
Good morning. I don't like this energy. Good morning, everybody. Good morning, my dear pharmacists. Are we happy to be here today? You're about to be happier to be here, I promise you. So I saw, when I was coming in earlier today, I saw a couple of pharmacists yawning. And I asked, like, why so low energy this morning? They said gala night was last night, so they did not get enough sleep. But I promise you that after this panel, in fact, during this panel session, you will not feel tired. Because as the name says, as the topic of this session is show up or shut down. So please sit up, give us your attention, because this is not a small thing that we have come here to talk about today. So again, good morning. My name is Pharmacist Onyinye, and I'm the Communications Manager for Drug Stock. And with me today at this session, my panelists, I have Grace Ikani, the MD and CEO of Cutting Edge Pharmacy and Diagnostics, from Michael Okafor, the founder and CEO of Drugwell Pharmacy Group. I have from Mrs. Busayo Ajimoko, the CEO of Crystal Rex Pharmacy Limited, and representing Drugstock's Chief Growth and Marketing Manager is Ololade Oni, who is the Digital Transformation Manager of Drugstock. Now, once again, thank you for joining what I believe and you are about to realize is one of the most important conversations in community pharmacy practice today. It's a session titled, I hope, it's already on the screen, Show Up or Shut Down, How Pharmacies Can Dominate the Digital Era Through Visibility and Relevance. So what do we know about digital health behavior today? According to Google Trends, 7 out of 10 patients begin their healthcare journey with an online search. So people are searching for medications, for nearby pharmacies. Where can I get my medicines? Where can I get genuine medicines? And a 2023 McKinsey report shows that over 65% of consumers trust healthcare providers who are easily discoverable online. So gone are the days where we are saying people don't trust healthcare providers they meet online. Now, you are validated by having an online presence. And in Nigeria today, WhatsApp is one of the top platforms for health-related inquiries, followed by search engines and social media pages. Now, there is a not so good news. Despite these statistics, many community pharmacies remain digitally invisible. You are nowhere online. You don't have an e-commerce platform. We are not seeing you. There's no website, no searchable presence. There's no way for patients to know you exist except they come into your pharmacy. And we know that these days, footfall is something that we appreciate from anywhere. Now, in today's world, pharmacy counter is no longer confined to a physical space. And if you're not showing up digitally, guess what? You may already be shutting down slowly. Because patients are increasingly starting their healthcare journey online, searching for trusted providers, comparing prices, looking at reviews. And even our theme, the Acpn conference theme this year, talks a lot about technology integration, because really, that is where the behavior is tending. The behavior of healthcare consumers, that is where it is tending. And as pharmacists, we have to step up to this behavior. Now, the conversation today is centering on this, because the gap is this. Being invisible is no longer sustainable for you as a community pharmacy, because you are losing patients, not because you lack the expertise. Of course, you are dependable, you are reliable, you are the first point of call for healthcare seeking community. But they can't see you online, and that's a problem. And you are missing opportunities. Insurance penetration in Nigeria is still very low, but it is coming up. It is rising very fast. And there are opportunities to fill this gap. But we community pharmacies are missing these opportunities because we are not well positioned for it. So essentially, there is a gap between what pharmacies offer and what the patients want. And we are here to fill that gap today. So the question is this: how can pharmacies stop being passive observers and start actively winning in this digital age? And this is what our panelists are going to come and are here to share with us today. So let's dive in. I'm going to ask the questions, and then they'll give us their take on all of these things we are going to talk about today. So I'm going to start with the Digital Transformation Manager for Drugstock, Odolade Oni. So you have experience co-creating health solutions with healthcare providers, including community pharmacists. And I know that your insights today will guide us into the broader strategy of how community pharmacists can scale by showing up smartly. So my question is this. In today's changing health landscape, where access to care is becoming more and more digital and patient expectations are shifting rapidly, what trends are you seeing around how medications are accessed, and what role can pharmacists play in staying visible and relevant?
All right, thank you so much for that question. Good morning again, distinguished ladies and gentlemen. Before I answer that question, I would like to hear from the house. So I want to ask, can you raise your hand up if you have had anybody come into your pharmacy to ask any of these questions? Question 1, how much is this medication? Please wave if you've heard that question. Thank you. Thank you. Question 2, do you have this medication? Wave if you heard that question. Question 3, is there a cheaper one? Raise if you heard that question. Thank you. Question 4, are you in partnership with any HMO? Raise if you heard that question. Now, I want you to look around. When I asked the first question, almost everybody raised their hand. When I asked the second question, almost everybody raised their hands. When I asked the third question, almost everybody raised their hands. However, when I asked the fourth question, very few people in this place raised their hands. The truth is that patients are looking for medication. They are going from one pharmacy to the other, asking all of these 3 questions. However, there is a fourth question that they are increasingly asking as the days go by. As of 2020, the National Financial Inclusion Strategy wanted to have 43 million Nigerians covered with insurance. That is the data. Now, another data tells us that we have about 3,800 registered retail pharmacies to a population of over 200 million Nigerians, which means that for every one community pharmacy is serving about 57,000 Nigerians. Now, that could look like a gap, but it is actually an opportunity. It means that pharmacists have a role to play in closing the gap in universal health coverage. It means that every pharmacy that is visible now is an opportunity for an underserved person in your community to access the medication that they need. Unfortunately, access to medication is still very deeply fragmented. As micro-insurance and digital health platforms begin to grow, we are soon going to be seeing millions of patients going around looking for pharmacies that have access to their plan. They are looking for pharmacies that can meet their budget, and some are simply looking for pharmacies that have medication in stock. And these people are not starting their journeys by asking the person close to them. They are starting their journey where? On their phones. They are asking Google. They are asking their health insurance companies. They are asking people that they trust to say, where can I access care that would not break my pocket? Where can I access care that would ensure that I am still served in this economy? So the pharmacy that would win today is not the pharmacy that has the biggest shelf. It's not even the pharmacy that has the biggest building. It is the pharmacy that is visible where it matters. Are you going to be there when they start their digital health journey? Are you going to be there when they are asking these questions? From the HMO enrollee that is looking for where to pick up their medication, to the sick mother that is looking for where to quickly get medication for her child. People are no longer just looking for medication. They are looking for certainty. They are looking for trust. And they are looking for speed. I want to ask you here today, are you visible to patients that are searching online for these 3 things? So I'll just allow Onye, Pam Onye, continue as we go on in this panel.
Okay, we are back. Thank God. So, thank you very much, Lolade, for that. There were two things you said that really struck me. You pointed out the universal health coverage, and then you said something about opportunity. So there's something that I've heard. Success happens when opportunity meets preparedness. So essentially, there are opportunities everywhere, but are you prepared? Are you positioned for all of these opportunities? And then about the universal health coverage, we know that insurance, healthcare insurance is one way that the global community is using to solve this problem, to achieve universal health coverage. We all know the Sustainable Development Goals. So I'm going to still ride on the insurance thing, and I'm going to ask you this from Busayo. I know that you serve patients under micro-health insurance schemes, so you definitely have first-hand experience navigating the realities of insurance coordination and patient loyalty. Yeah, so in your experience, what happens when a pharmacy becomes part of a program that serves people who may not traditionally walk in, right? Like, such as those on health plans or community-focused care models?
Thank you so much, Famoye. And I believe, quite a number of us here, we understand when we talk about cash flow. Like we say in business, cash is king. But, there are lots of diverse ways that people go about this. And for me, one of the hallmark or one of the major organizations that created this difference for me was partnering with, a company that is innovative, and that company is Drugstock. And how did this come by? I remember being involved in a particular program. They have like an HMO called Kankbe. And the most interesting thing for me was when I saw the people that were involved in this partnership. And this was an international company, international organizations such as AXA Mansard and PHARMACIST. And we know that these are organizations that are driven by excellence and integrity. And the difference was that the footfall in the pharmacy increased. Not just because the pharmacy had a reputation or a name, but there was a form of accessibility which was easily in the reach of the people in the community. There is a way you can have, an outlet, and some people, some demography feel this is beyond our reach. Why? Maybe because of the outlook and all that. We all know a lot of these things is packaging to attract your target market. But beyond that, there is a way a regular person can feel this is beyond my reach. But due to this program, quite a number of them were able to come in, and they saw that things are not even the way they think about it outside. Prices are not all that big. They can still, partake of these things. And what was the resultant effect? We had better cash flow due to this patronage. Aside from that, the place of pharmaceutical care. I know as pharmacists, we speak a lot, especially pharmacists in the community space, we speak a lot about pharmaceutical care because we don't just want it to end in the place of buying and selling of drugs. But we want to ensure that the end result is patient care. We want to ensure that our patients are well taken care of, and our patients, they don't have reactions and all that. So when we get, the data, extensive data, well-detailed data of, of all these patients, it's easy to follow up. It's easy to, to be able to reach out to them, even for other things. And aside from that, recommendation. We've had, quite a number of patients go to even see consultants by paying this token, just, token that could have been overlooked. And some will feel that, I don't think I can afford affordable health care due to this. So for me, being a part of a working system, being a part of an innovative organization is just bigger than just the little thing that is achieved at that time, but it's about the big picture. And I believe that I cannot overflog, that topic and the interest. Thank you.
Thank you very much, Rambusayo. I like when you talk about innovation because, of course, that's, drug stock is about innovations for those who know about drug stock. And then access. We know that access is a big thing that many healthcare companies are trying to solve in Africa. Access to quality medicines. And like Tonade said initially, you talked about the ease with which, for example, a mother with a sick child can access healthcare. These days, it's not just about accessing medicines. Healthcare consumption as a whole is a big thing now, and pharmacies are very well positioned for this. And still talking about access, I'm going to Sofa Michael. Good morning. Is your mic working?
Good morning. Good morning.
Great. So for Michael, still on access to medicines for the end consumers. Have you tried any new approaches recently to reach more patients or improve how people interact with your pharmacy? And what have you learned from the experience?
Yeah. So yes, I did try. I joined a pilot program with drug stock, and they promised me they were going to make me visible. And by the way, we have pharmacies in Lagos. We are based in Lagos, and they promised they're going to make me visible. This time, not physically, but digitally. Almost literally. I started getting calls from people, and I started seeing people walking. They came in with a prescription, and according to them, they found us out on a platform while they were searching for their drugs. We didn't advertise. I didn't put my pharmacy, online there. I'm certain that there was nothing else I had done. But we're getting calls, and people were walking in. And like I said, according to them, they found us out while they were searching for the medication that they needed. Very interesting, a game changer indeed. What did I benefit from the things that have happened? I said, people were in. I remember this is a pilot program. So I can only imagine what will happen when they go to full scale. Secondly, interestingly, when to a pharmacy, from what they came to get, which already they had sorted out before coming, these customers also had the opportunity to buy other things. We had the opportunity to upscale them and to upsell, get them to get some other things, or they see something else that was different from what they wanted initially, but they wanted anyways. And then, for me, that was fantastic. And thirdly, it was an opportunity, to be visible. It's an opportunity for people to know me more as a pharmacist. You see, today, our customers' behavior is becoming a little more sophisticated. People don't like just jumping around everywhere, trying to look for a particular item or a particular drug. People want to search what they want. After they've found it, then they'll go straight there where they want to get those things, because there's an issue of time and there's an issue of unnecessarily moving around. I mean, if you live in Lagos, you know how very chaotic Lagos could be in terms of traffic. But with this, what I found out is that people are finding me. I'm becoming visible to people around. And it will shock you. There might be people around you, around your pharmacy. You might think they are seeing you. Honestly, they probably have not even known that you are there. But somehow, this is an intentional and a strategic way where customers come looking for you and they are getting what they want. And don't forget, in the course of searching for me, they already knew the stock that they want, the product that they wanted, and they knew that I had it. For me, that was excellent. Now, just as a way, just to conclude my response, today we are talking about technology integration, and if you're not careful, the way it's sounding like something that's going to happen in the future. I must tell you, this company, Drugstock, is already here, right here and now, already bringing the future into now, responding exactly to those things that you need. So we're not far anymore. That future is already here. And I assure you, the experience is seamless, it's fantastic, not too much hassles. For me, it's a game changer, and I'm in for it. And let me say this. So you guys, for the pilot project, you're only doing it for one branch. Because you are scaling, I'm also going to scale it to all my branches. That's how interested I am about this project. Thank you.
Thank you very much, from Michael. And I feel like, clapping, but my hands are full. But essentially, it's amazing to hear this, because when we started the Good Pill project pilot, we had a lot of questions. We had a lot of things we wanted to achieve with it. And now hearing the feedback from someone that participated in the pilot, it's exceeding our imaginations, because the plan was to fill an access gap. And not come and disrupt the behavior of people, how all these fresh tech companies come and want to disrupt. No, it's essentially working with the already existing behavior. This generation, they want to search online. They don't want stress. Gone are the days where people will go from pharmacy to pharmacy looking for a particular drug. And then when I was a community pharmacist, many people would come, where can I find this? And then you direct them to another pharmacy. And they will tell you, I already went there. They said I should come to this place that you people will definitely have. And I'm like, oh my God, I'm so sorry. But now people don't want that stress. People that have worked with Gen Zs, you know what I'm talking about. They want to be in the comfort of their bed and you come and give them a bath. They don't want to lift a muscle. And this is the behavior that we have observed. And then we are saying community pharmacies should not be left behind. We should all, because when you grow, the healthcare system grows at the same time. So because of this is why we launched the Good Pill project. And like From Michael said, it was one of the pharmacists on the pilot phase, and he experienced not just more footfall, but having customers, having clients that you can upsell, and having clients that know you, even if they were not seeing you before. Like, they could live on the same street as you do, as where your shop is, but they are not seeing you. So these are the gaps that we are filling for community pharmacies. I won't talk so much about it because we are pressed for time. I'm just going to go straight to Farm Grace and ask you, so based off of what Farm Michael has said, and I know for a fact that pharmacists these days say that their biggest competitor today is not another pharmacy. Actually, it is not being found at all. So from your experience, what do you think pharmacists miss out on by not being easily discoverable to patients, especially those who compare price? Let's be honest, they compare prices. Who compare prices or rely on insurance? No. Please, we have a microphone issue.
Okay, good.
It's working.
It's on.
Okay, good morning, fellows in the house. Good morning, colleagues. Good morning, Drugstock. And thank you for this opportunity given to me, at least to air my own part of this message today. And the question is simple. What do we miss out? But before I go to what we miss out, I would like to actually probably broaden our minds on visibility. You have to exist to be discovered. Mm-hmm. And if you are talking of being discoverable, we are talking of you being easily accessible.
Yeah.
We cannot overemphasize the benefits of accessibility when we need to do something that is key and pertinent to humans, especially as healthcare providers. Visibility really, like you said, is not just a thing, but it should be what we all have to strive for. It's apt. And that's why I'm a bit, not just a bit, I'm actually happy for this year's theme, which is talking clearly about digitalization, technology, and all of that. And if we listened to the keynote speaker right from the beginning of the conference, it has been about digitalization, it has been about technology. And that is where this particular topic is hinged on. And so to go to your question on what we miss out, I don't want to overflog the benefits, which is in the financial aspect. Busayo has spoken a lot about the financial credibility and all of that. I want to peg my response on 3 key factors, 3 key credible factors. And the first one is trust. The second will be value. And the third one will be growth. I can just use an acronym, TVG. So, if we talk about trust, I need to find you, to know you, to trust you. If I can't find you, there's no way I can trust you. And the rate at which the world is going, the world is not about our physical presence anymore. It is more about being able to find you in the sky.
Yeah.
If you look at what our children do these days, holding that thing in their hand is the entire world. If I ask anyone on the street, not even medically inclined, about a particular medication, if I give them 2 minutes, they will go on either Google, on GPT, or they'll go on AI and give me the response. So you are not just there to provide counseling, because they already have parts of the counseling. But what does your visibility do? It gives people trust to know that for you to be found in a particular space, it tells me that I'm partnering with people that are nationally and internationally inclined, that have that can give me that ability to trust. Then I, as a client, can easily go to that particular pharmacy and say, because I could find them where I looked for them, it means they are credible enough. That is hinged on trust. Secondly, we talk about value. If I can't trust you, I don't even know where to place your value. There's no value if there is no trust. So for me to have value for you, I should be able to find you. I should be able to say, drug stock is here, health self pharmacy is here, Life Bounty is here, and I can see them and I can place value on them because I have tried to get a review on them. I've checked them out. I've done the review. I've checked their prices, which means I can have value to say I will do business with this particular pharmacy. Then we talk about growth. If you're talking about growth, when you are available, when you are visible, when you are accessible, it's tending to what we call sustainability. And at the same time, you are growing. The relevance is there. You are not just staying in this position, but you are striving to be relevant and striving for the best at all times. Now, I also belong to the Kankpe Care Group. I've been part of it, and thanks to drug stock. And like my colleague said from Busayo, the Kankpe has helped us in a long way. And what I want to tie this particular session to, that's the second, the B part of this session, is what benefits I have received on this platform and partnership. So what it is simple. Partnering with the right source, the credible people, has been a great benefit to us in Cutting Edge, and not just to us, most especially to our clients. We don't want to call them patients. They are our clients because they are not just there for drugs but they are there for adequate health care. So as we provide this health care for these people, what are the things that we provide for them? And how has that helped us? Value-based care. Partnership has been able to provide us with value-based care. Secondly, it has been able to provide us improved medical adherence by our patients that come to us. We now have retainership and more footfalls, both physically and online. And how does this help? If I'm partnering with a company that gives me ability to have this micro insurance for my people a little bit of cost that gives them a whole wide range of health care. They trust me more, they have value for me, and it helps me to grow, and at the same time, give them what we call value for their health, and most especially, sustainability. And that helps us to reduce mortality rate at all times, and keeps us one-in-one with our patients, and help us to have that personalized care and looking out for our patients at all times. I'll just conclude simply by saying that partnerships is not just a nice to have, but they are the bridge between staying local, or what do? Becoming scalable and relevant. And it's either you do what? You are in, or you are already shutting down. So my advice to each and every one of us, don't just exist. Be relevant.
Yeah.
Be readily available. Be accessible. And please, go global. Your network is in the air. It's not in your business space. Thank you.
Let us clap, please. Thank you very much, Fam Grace. That was a very good one. And yes, you said a lot. And I'm going to speak to the partnerships part you said. You know, I know that many community pharmacies and pharmacists, when it comes to partnering, they're a bit shy because you don't know what does this person want. There has to be something, an ulterior motive. And I'll just say this, right? For us at Drugstock, our vision, our mission has always been empowering healthcare providers. And most pharmacies that have partnered with us today, whether on Pilometer, on Kankpe, or our e-commerce, or even now that we have started the Good Pill, they have nothing but good to say. Because the truth is, pharmacies or healthcare providers generally always come first. That is how it has always been, and that is how it will continue to be. So even as we scaled up to the Good Pill now, we saw a lot of pharmacies wanting to partner with us. Even if it was a very closed group, we had to tell people that, okay, that like it's already full. The pilot phase is full. We can't take any more people. It's the credibility, and for me that spoke a lot about what it is we have done, and I'm grateful for the trust that community pharmacies, hospitals, and everybody has placed in Drugstock, and we assure you that we will give you more reasons to trust us. And I'm going to go back to Lolade now. So, if a pharmacy owner here today wanted to become more visible or attract more patients, whether insured patients, price-conscious patients, or clients, as Fam Grace has corrected us, or clients who are simply surfing the web, what's that one step they should take this month, not this month, what's that one step they should take today to get started?
Okay. So you don't need to build your own system. You don't need to wait for the right time. The solution is literally in your hands. I want you to look at your hands, look at your table, and if you have this, can you wave it? The solution is in your hands. Can you wave it if you have it with you? If you have it with you, just wave it. On this flyer, you have the Good Pill Project. The Good Pill Project is a growing ecosystem where we make sure that patients, wherever they are and whatever plan they are on, whether or not they are presently underserved, have access to medication whenever and wherever they need it. And we recognize that you are part of how we can solve that problem. You need to be visible. You need footfall. And we want to empower you to do that. We want to affect 2 billion lives, and you are the pathway to ensure that that is done. Simply pick up your phone wherever you are right now, without spending a dime. Go ahead and scan the QR code behind this flyer. Can we try that on the stage also? Go ahead and scan the QR code behind this flyer. Okay? You are directed to a site. You click on go to the website. And in less than 2 minutes, you are about to become visible Should we do a countdown?
I like countdowns.
Yeah.
All right.
Go ahead.
5,
4, 3.
Some people don't have flyers. Please, if you don't have a flyer, you can just wave your hand and somebody will get a flyer across to you immediately. Please, let's make sure we all have flyers. We'll do this countdown together. Please, I just scanned it. Ensure that you have internet connection. Scan your flyer. You are about to become visible. I want to tell you today that anybody that has an insurance plan, Drugstock is partnering with one of the biggest insurance companies in Nigeria right now. And so if you are in Lagos, as soon as the next month you start getting orders, insurance orders, for those of us outside Lagos, within the next 6 to 8 weeks, we'll start getting orders. And even if you are not in Lagos, so long as people are searching for medication, as we know that they're already doing, then they will definitely find you because you are about to become visible. You are about to partner with the biggest footfall generator you can ever think of. So let's get our flyers and scan. Do we all have flyers now? Please, ushers, let's get flyers across to everybody waving their hand. There are some people in front here. Please get flyers across to them.
I can come down and share flyers. Oh. I'll moderate the sharing of the flyers.
Flyers, let's make sure flyers are around. You can also go to the Good Pill Project. As we count down, once we get to 1, I want everybody to say the Good Pill Project. Can we do that?
Yes.
Yes, we can.
5, 4, 3, 2, 1. Visibility.
The Good Pill
Project. Thank you.
Thank you very much. So while we are doing that, we'll just round up the session. I thank everyone who has paid rapt attention. And remember, at the beginning of this session, I did say it that get ready to sit up and hear the best news, you know, probably the best news that you have heard so far. But well, this is very good news. And visibility is something that we should always strive for as community pharmacists. I don't know how many of us here have our own company websites or e-commerce sites, but not to worry. Once you sign up on the Good Pill, it serves that purpose because you are visible. In fact, it's even more targeted because this is traffic coming straight to you. These are people who are already ready to buy, already willing to buy. They are searching for these medicines because they want to purchase it immediately. And then when you come up, they are directed to your pharmacy, and then you take it up from there. It's really a good one for the pharmacy practice, and it's something that we are proud to herald at Drugstock. And lastly, when I got to know about the conference tag, IFEADIGO, I said this is exactly what the Good Pill is about because light has come. Light is here. The Igbo people here, I hope I'm not murdering the pronunciation, no. IFEADIGO. IFEADIGO, my Igbo is still very solid. So yeah, this is light. You are stepping into the spotlight. And we assure you that it's just going to be more good news from here. We thank Acpn for the opportunity to present and to have this panel session. And, you know, as men of honor, we keep joining hands. Thank you so much.
Thank you so very much, Drugstore, for this amazing presentation. Now we know how to go about our practice to maximize output. Thank you very much as you take a bow. Next on our presentation is, next on the list is a masterclass by SFH. The topic is improving access to healthcare services and products through e-pharmacies, considerations and future steps. The chief speaker is Farm Okafor Uchenna, PhD, MPH, B-Farm. Other speakers are Farm Emmanuel Ogundimini, Retail Manager, Health Plus Pharmacy. The second is Farm Ignatius Anuku, FPSN, Business Manager, Alpha Pharmacy. The third one is Farm Adioye Oyerinde Isaac, Business Development Manager, Med Plus Pharmacy. Can we give them a round of thank you, SFH? Thank you.
Okay, 20 minutes. All right. Good morning, everyone, and welcome to the SFH panel session. We will be commencing this session with a technical presentation by the Chief of Party, ePharmacy for Family Planning Project, Society for Family Health, Dr. Uchenna Okafor. She'll be taking the technical presentation, and after which we'll be opening up the panel discussion. Okay, so we'll just hang a bit for the technical team to fix up the slide. Well, you can just take this. You want to stop? Okay, all right, all right. All right. All right, we'll just wait a bit for the technical team to put up the slide. All right. Thank you very much, everyone, and welcome to the session.
Good morning, my dear colleagues, ladies and gentlemen of honor. I thank the ACPN for this opportunity to present at this esteemed conference. I am Okafor Uchenna, and I'll be presenting part of a project called the ePharma for FP project, funded by the Bill and Melinda Gates Foundation, that looks at e-pharmacies and how we can expand the viability and feasibility of using e-pharmacies to expand access to health products and services. And for us, we used family planning as an entry point for what we did. But very interestingly, all the conversations we've had, and even the theme of our conference this year, speaks to the importance of digitization in the community pharmacy practice, and seeing that it's actually the way to go. And then you can even see that Nigeria as a country has already commenced her journey towards digitizing her entire health sector. And the pharmacy bit cannot be left behind. And so today I will be speaking to some of the work that we've done in this masterclass, just towards looking at how best digital pharmacies, or e-pharmacies as we call it, can be optimized to provide several services, just beyond providing only medications, but also being a primary healthcare provider, for example, being a family planning service provider, or even a provider of several essential primary healthcare services that we have in the country. So without wasting much time, please can we go to the presentation? Thank you. Okay, so please. Okay, so this presentation is themed Shaping the Future of Healthcare Access and Delivery through e-pharmacies. And so I'll be going through this, and then after that we have a number of persons here who are seated, who are basically operation leads for existing large-scale e-pharmacy organizations currently in country to give us their experience as well as challenges they faced and things they've done to mitigate those challenges, while I run through some of the things we've done on the project to also try and optimize e-pharmacy systems, which we can learn. And I will believe that other community pharmacies in here can also look at how they can expand their access through e-pharmacies. And a lot of it was talked about in the previous presentation. But in this case, we are looking at individual pharmacies that have been able to expand themselves. Largely, we have these three organizations on board who have worked with us, and then they have a very large-scale e-pharmacy focus within the country, especially in metropolitan areas, and they're looking at extending it also to underserved areas, increasing access to not just medication, but healthcare to the populace. And so for our presentation, so I've spoken to the overview. We're looking at evidence on generating evidence on the effectiveness of hybrid e-pharmacy systems, developing scalable models that we can use for underserved areas, and also, most importantly, we did a lot around policy and enabling environment. What are the things that can be done to create an enabling environment, both within the policy angle and within the entire ecosystem, to improve trust for e-pharmacies, but also to ensure that we provide quality health services to people and to the clients that we serve. Okay, so I'll quickly run through this. For us, we looked at e-pharmacy and how the family planning can be placed within this. And we could see, using Lagos as an example, that we could shift the indices for their family planning product access usage using e-pharmacies. And we actually tested it with the e-pharmacy we had on the project. And in this case, it was Health Plus. And so I spoke to the fact that, the policy ecosystem was key to it. And then one beautiful story I want to bring to the fore today was the fact that when we commenced our project, say 3 years ago, 2.5 years ago, we realized that the digital space was moving, but there was hardly any regulation in the country to guide it. So we had no e-pharmacy policy. And so what did we do? Working with the partners on the project, specifically the Pharmaceutical Society of Nigeria Foundation and the Pharmacy Council of Nigeria, we were able to identify a number of policy gaps that we could fill on the project. Then I can speak to you, as I speak to you today, we actually have 3 core regulatory regulations and policies that are currently being finalized to guide the digitization of pharmacies, especially the operation of e-pharmacies in the country. The first of it is the e-pharmacy policy, which is currently being finalized with support from the Federal Ministry of Health and the Pharmacy Council of Nigeria. We also have the e-pharmacy regulation, and I will ask each and every one of us to go to the PCN website, and you will see the draft e-pharmacy regulation that has been hosted there for quite some time. And you're free to make comments as to things you are not clear of or things you will want them to change. But most importantly, for you to also understand what the country is thinking around regulating the digital space, especially for digitization of e-pharmacies or digitization of pharmacy practice in the country. So very importantly, please go to the PCN website and you will see that. We also have, most importantly, the development of the prescription and dispensing policy for the country, which sadly Nigeria has been struggling to have that policy for the past 13 years. But luckily that is almost finalized, and that should be done hopefully before the end of the year. Also, together with the Federal Ministry of Health and the PCN, we've been able to put this on the front burner. But most importantly, we want to ensure that as innovation is moving forward, as digitization of the pharmacy space is moving forward, we ensure that we are protected as providers, we know the right things to do, and then the client is placed at the center of the service that we provide. So I spoke to the fact that we worked with Health Plus Pharmacy to try to understand what the e-pharmacy space is like and how best we can optimize it. And so we had to do a number of things. First of that was to look at how can the pharmacist interact optimally with the clients when he or she comes online. So we put up several things which you will also see in the guidelines, which include opportunities for you to chat with a pharmacist, opportunities for you to upload prescriptions and verify your prescriptions digitally, online, virtually before you dispense drugs or dispatch them to your clients. We looked at how best can we optimize logistics and delivery. We understand what transportation costs could be in Nigeria. We understand that some places are hard to reach, difficult terrains. How best can we optimize it such that e-pharmacies can thrive within this space and provide optimal services to the clients? We also looked at how you can conveniently also provide that service. So we looked at how we can have apps that can help with appointment bookings and all of that, just to ensure that the client is conveniently served. Very importantly also, we looked at several aspects of even we call them the e-pharmacy platform on itself. Now, not many people may be able to have a platform, but for those of us that have it, if it's a website, what are the key things that need to be there such that your client is able to effectively interact with it? Even if it's WhatsApp, what are the key things you need to have on ground such that you can be able to provide professional services to the clients that meet the standards that PCN has set within her guidelines and within her regulations? So I'm not going to dwell so much on this because my colleagues are going around and they'll be sharing with us a booklet and some of our materials that can give us in-depth information on what is currently in my presentation. So I'll just run through it very quickly. And so one important thing I want to bring out here is that for us to actually start our work, we wanted to actually look at what do the clients out there tell us and what are the things that they really need to be able to provide their services. And so we're able to identify some barriers, and then we use these barriers to evolve the work that we're doing. And then you can see that the barriers span from both awareness, what are the things that we can do to create our awareness, to put ourselves in the digital map. What are the things we can do around adoption? As a pharmacist, what are the things I will do to ensure that I'm out there, and then the clients that I serve see me as being placed in a proper position to serve them with quality health services. And lastly, they would come back after that service to continue providing, for me to continue to provide services to them. And so there's several levels of barriers we looked at, and as best as possible, we'll try to understand how best we can address this. And our panelists will be speaking to that as we go on. So this just gives us some breakdown on some of the barriers that we saw within the general population for family planning use, within the underserved population. But one key thing we can see from the statistics is that mobile phone ownership is huge. Mobile phone ownership across both the general population and even places that we term underserved and poor locations, they all have smartphones. That means they are potential clients. They are people we can reach with our digital services. And so I would ask us, how best have we positioned ourselves with the devices that we have? You don't need to go with huge infrastructure. You don't need, with your phone, with your tablet, you can provide those services. And then you can, with very minimal cost, set up low-cost websites that you can use to provide these, or even use currently existing apps that you can latch onto to provide this. But it's just important for us to see that mobile phone ownership, smartphone usage is very, very high And not just within the Gen Z population, even the general population equally have very high smartphone usership. And we need to be able to leverage on that as pharmacists digitally to expand access to primary health care. So these are also several barriers we saw for the underserved population, which is in the booklet that is being shared. So I won't go into it for want of time. But most importantly, outside talking to the general population, we talk to pharmacists like me and you who are currently within the digital space providing family planning services. And we're also able to identify a number of, I think we spoke to about 18 of them. And we're also able to identify a number of enablers and a number of barriers, which we also actively try to address within the regulations that were put in place currently by the PCN as well and the Federal Ministry of Health, as well as the work that we did on the project. Okay. One key thing that came out there was the fact that there was no system to verify prescriptions within the country at that time, 2 years ago. And that also led us to our work with the Federal Ministry of Health and the PCN to work with the NMA to come up with the current draft prescription and dispensing policy that we have for the country, which should be finalized in a few months. So I'll be ending this with a few learnings that we had, basically on the policy and then on the technology and service delivery aspects of what we did, okay? And most importantly is the fact that even though we have these policies in the pipeline about to be finalized, a lot of work still needs to be done within the pharmacy ecosystem towards sensitizing all of us, pharmacists, who are supposed to be players out there. We're going to be the potential, owners of the e-pharmacy spaces and the e-pharmacy work that would happen in the future as it grows and as the regulation is bettered. And so it's important that several mechanisms are put in place to help its evolution. And one key thing that comes out of this is that going back to even the curriculums within our universities, what kind of pharmacists are we betting out from the universities? Are they pharmacists who are equipped with the right knowledge for digitization and the era that they are entering currently as they graduate? Or are we still just focused on the theories without the realities of the practice that we have? And then minus that, those of us who have already graduated, how are we equipping ourselves both with knowledge and technical skills to be able to play within this field effectively and enhance our visibility, but most importantly, the quality of what we are, providing to the populace? So with this, I would want to thank you for listening, but most importantly, move on to the panel. I have a couple of questions for my esteemed panelists, who are here. I have, I'll introduce them again very quickly. Pharmacist Emmanuel Ogundimini. He's the head of retail operations for Health Plus Pharmacy. And we also have pharmacist Obolu Ifeanyi, He's also the head of retail business at Alpha Pharmacy. We have lastly pharmacist Adioye Orierinde Isaac, who is the business development manager for MedPlus Pharmacy. One thing unique about these three pharmacies is that they have very large e-pharmacy bases within the country that covers a large span of clients. And they've been at it for years. They've been at it and they've had some challenges. They've also had some things that have actually made that space very viable. And they're here to share that with us. So, I'll be asking them a few questions. I'll be commencing with Emmanuel from Health Plus. Health Plus was actually the very first e-pharmacy in Nigeria as far back as 2019 with the evolution of the COVID-19 pandemic that we had. And we know that was the beginning of the change and the start of the digitization era globally, not just for Nigeria. And so, Emmanuel, can you please elaborate on how e-pharmacy has evolved within Health Plus? touching upon your platform improvements, customer feedback, and the product ranges that you expanded.
So at Health Plus, we were talking about, I was discussing with a couple of colleagues yesterday, and we were talking about the age of technological advancement. We have early adopters, we have blah, 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 blah. Unfortunately for us at Health Plus, we were the early adopters, and it was born out of the need, right? So during the COVID-19 shutdown, everybody were affected here, and then we just thought about it. What do we have to do to get our customers, our client base, to access medications? I mean, there was lockdown. If you're not a service delivery provider, thank you. If you're not a service delivery provider like food or medical or healthcare service delivery provider, you are locked down. And people were yearning to get well. They need to, to refill their prescriptions to get what they need. So we thought about it, how do we get these things across to people? So we started with the normal thing on our hands, our phones. WhatsApp is there, telephones and all that, and we put out the numbers to people. You know what, you don't have to come around, you don't have to just request, and then we get it across to you. And then we improved upon our logistics delivery system, where we're able to, in a matter of minutes or few times, we're able to get medications across to you. So we started with that, and over time, in addition to that, we're also getting feedbacks from our customers. So how do you want us to serve you better? What do you need? So we have a lot of people talking about, you know what, I cannot use WhatsApp, or I don't feel safe making calls. Some persons might be tapping my voice, blah, 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 blah. And then we looked at it, okay, let's go online. We could develop a website and then have online consultation, speak with a pharmacist, draft orders, go there, pick what you want, even if you don't want to speak with a pharmacist, and then we get to serve you. So over time, with feedback from our customers, and that is the key, feedback, customers we're talking about essentially everything we do in healthcare. It is for the customers, right? To empower the outcome. What are we taking out? What are people benefiting from the healthcare delivery process? So we just listen to the customers, to our people, and then we implement on the go. We're currently not there yet. We're talking about digitalization, and it keeps increasing. Even at Health Plus, we keep having courses on AI implementation, on how to, just to build ourselves to serve the customers better. So that's basically what we look at, and we continue to do that. And it's just to encourage everyone also to build into this system. Thank you.
Thank you very much, Farm Emmanuel. Okay, Alpha Pharmacy, Farmifying, drawing from your experience, okay, could you address some of the commercial viability and sustainability models that you implemented within your e-pharmacy platform, okay? And also let us know what your thoughts are on how we can establish trust and also ensure a robust authentication process for the e-pharmacy platform.
Okay, thank you so much, Dr. Uche. So I would like to say for commercial viability, it's no-brainer that if you look at the general market, the e-commerce market, one thing you will notice is that the healthcare segment of that market makes up for less than 3%. And that shows opportunity, it shows opportunity. And we have a growing population in Nigeria, the youth being a higher percentage of the population of the country. And they have already adopted, engaging these platforms, other platforms, e-commerce platforms. So the question will be, how are we positioning ourselves to ensure that we appeal to this audience and make our pharmacies more like go-to when were being searched on, on platforms. One thing I can say for Alpha Pharmacy is this, that is certain. We started a few years back, and it has been really promising. Talking about the commercial viability, you can tell that a major segment of our revenue contribution actually comes from, our e-commerce platform, and that's really amazing. Looking at trust, I would say trust is more like the lifeline for healthcare. Trust is more like a lifeline for healthcare, and rightly, every player in the e-commerce space currently already have a brick and mortar store, right? And that brick and mortar store means you've been interacting with clients over the years. The trust has been definitely yes. And if you look at the product authentication, even going down to other things, you would see that as pharmacists, we're men of honor. When you're men of honor, so getting the medication is one thing we can always get. But when you have to start taking it to other climes, you want to get to someone in Sokoto, for instance, or someone somewhere else, you would find out that there is a need for medical conscious logistics to ensure that the product viability at the end user is actually what it is. Thank you so much.
Thank you so
Appreciate
much, Fine. And lastly, from MedPlus, we'll be speaking, Ifeadiago will be speaking to us on making strategic investments in digital pharmacy channels. What kind of investment and opportunities do you foresee for collaboration with tech platforms towards enhancing last mile delivery to underserved locations and basically enhancing the e-pharmacy system as a whole?
All right, thank you very much, Dr. Oche. Good afternoon, colleagues. For us, we are very strong on the drive to deepen access. Currently, we have footprint in 19 stores, right? The old drive to, should I say, reach unreached communities stem from, post-COVID era when we had to reach people in their homes. And this you will see in how we do what we do, particularly around, if you check our bags, you check our stores, from revamping our websites, which was a major investment for us in infrastructure and personnel, to checking just our bags where you can see our QR codes or you see phone number to be able to reach us, even just on WhatsApp. So this has over the years evolved and helped us significantly. Also, experience with our Q-commerce partners also gave us a kind of insight into how we even need to run this whole thing. And I many times ask myself, if food can get to people in 15 minutes, it means we need to be able to get medications across to people that need it, even in less than that time. So this and many more are things we do, and I really must say that it's been a very rewarding journey. Thank you.
Well, thank you so much. They've been able to share their experiences, their challenges, but most importantly, things that we can imbibe, towards having more players within the e-pharmacy space. Regulation is coming on board. There's so many things we can tap into. He mentioned the QR codes, which is another digital way that we can quickly get people to go to our website. And so many things which have been implemented across their platforms to increase user experience and also improve the quality of the services they provide virtually to their clients. So I want to thank everybody. I want to thank Acpn for this opportunity for us to showcase what we've done and the beautiful work our partners are doing on the project. And I want to enjoin each and every one of us to move into the digital space, identify your niche, take onto it, tap into it, and run with it. And the future of pharmacy will be very great. Thank you.
Thank you so very much, SFH, for that wonderful presentation. We appreciate you.
Thank you.
Thank you very much as you take a bow. We are grateful for this wonderful presentation because we know that the future of our profession is domiciled in the e-pharma space. Innovation, 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 technology advancement, and health transformation. Thank you once again. We appreciate you. Somebody misplaced some cards, bank ATM, ID card, and driver's license. It was picked up at the car park. The name is Edoja Pius. The person can come to the protocol stand for identification. Thank you very much. Next on our item is another presentation, a company presentation by Rekit Benkisa. Rekit Benkisa, are you ready? It's Rekit Benkisa. Rekit Benkisa. We're going to be having an Afrikana night at about 5 p.m. in this hall this evening, after the town hall meeting. APIN. If Rekit Benkisa is not available, APIN, please can we have your company presentation? CPACPI. Acpn Public Health Initiative. APIN. Take it off of me. You have 10 minutes.
I'll try. But please, ma, where's the... Okay.
They will guide you. Somebody left. Yeah.
Who is supposed to guide me on how to use this?
Is you need a guide. Yeah? You need to be guided.
She's just going to do a practical for me.
Oh, okay. 10 minutes. Okay, he wants to be guided on how to do it.
It's just it's a point now. The arrow is to move this line. Good afternoon. As men of honor, my name is Ifeadiago Lawal. I'm a pharmacist and the regional lead for Rekit, South and Southeast, OTC. Okay, so today we'll be talking about Gaviscon, or appropriate reflux management. So we're going to take it in 3 parts, where we get to understand the introduction of GERD, the prevalence, diagnosis, symptoms, and physiological mechanism triggers. Then we'll look at the appropriate reflux management style we should be using, and then we'll come to the benefit of Gaviscon in reflux management. Now, 1 in 8 people have experienced reflux at least once a week. And if this happens to anyone, we are the first people they come to for help. Now, GERD is a chronic condition where stomach content flow back into the esophagus, causing troubled symptoms like heartburn, regurgitation, chest burning, and sometimes causing mucosal damage if it's not well managed. But then, how do we diagnose this? If it's a mild symptom, it happens at least 2 days or more. But if it's really a moderate or severe symptom, it happens almost on a daily basis, and that means we need to act right in that regard. But what's really the key cause of GERD? The key cause of GERD really is the weakness of the lower esophageal sphincter. Now, the misconception has been that it is acidity, but it is not. This is actually the real reason why we have GERD. So these are the major highlights of what people go through when they have these symptoms. Sour taste, stomach discomfort, chest burning, sharp pain, stomach burning, and bad breath. Now, this lower esophageal sphincter is just, to act as a barrier to protect the esophagus so that stomach content do not come back up and hurt us. But then when that lower esophagus is weakened, that's where the problem begins. What will happen in that regard is the stomach content now begins to come back up, and then the acid that is being produced to help digestion is now beginning to hurt us around our esophagus. This is the main reason why we have this GERD. Now, it is not only the acid production that is important. What is actually most important is the super concentrated layer, which is called acid pocket, forms in this part of the stomach. Oh, okay, this is not working out. I've pointed it out. So now, when we eat, we will initiate some sort of acidity and comes to the top of the stomach. When that happens, it forms a layer called acid pocket. This acid pocket, whatever is going to solve this problem, must be able to block that acid pocket from getting to the esophagus. And then we'll see what solves it later. But before we get there, what are the physiological and behavioral factors that can trigger these reflux symptoms? We have them in two parts, the physiological reasons and behavioral. But the one we see the most is that over 45 years old patients go through this more. Pregnant patients also suffer this effect. Who have central obesity is also there. Hiatus hernia is another reason. And then we have irregular eating habits. Now, we need to rethink how we manage reflux in our practice. And this is what we have shown, we have found out. There are assumptions that patients understand healthy dietary lifestyle and limited role in non-acid suppression treatment. It's not all patients that actually know how to help themselves when it comes to lifestyle. So as we are trying to treat them, we need to also advise them on the kind of lifestyle they need to live to maintain good health. Then the focus has always been acid suppression for us in community pharmacy. But the real problem is not to focus on that acid suppression. The real solution is how the acid will not get to the esophageal area such that we can now protect the mucosal wall around the area from being hurt. So what do we need to do in 3 parts? We need to start encouraging patients to self-care. We need to start managing their psychosocial and lifestyle factors, like dietary. Then we need to consider alginate antacid-based treatment. I'll take that again. We need to consider alginate antacid-based treatment. We can have antacid, that's good. But the antacid only goes down into the stomach wall and reduces the acidity. But it doesn't protect the content of that stomach coming up to now cause the pain or discomfort on all the symptoms we are talking about in this topic. So anything we are going to use to treat this must have alginate-based solution. And while I am at it, I'm going to have to show a practical that will be done here. So you see what happens when a patient actually takes in Gaviscon, and then we see what happens in the stomach. But while that is ongoing, we can now go ahead to see all of the other lifestyle changes. Things like high fatty foods, spicy food, acidic food, alcohol, caffeine, chocolate, and carbonated drinks So we also need to start changing some habit like not eating very late and eating small. Now, other lifestyle changes are losing weight, maybe stop smoking, and consider raising our heads when sleeping. So, what is the benefit Gaviscon double action gives in managing reflux symptoms? Recall that in my previous slide, I said the solution to managing gastroesophageal reflux disease is something that does not only manage the acidity to go lower. We also need something to block that stomach content from coming back up. Now, this is how Gaviscon works. The liquid alginate enters the stomach unchanged. It gets into the stomach. Then the stomach acid precipitates the alginic acid and forms CO2 to create a buoyant raft, which is that white thing you're seeing there. And then the calcium in this form now makes it stay for up to 4 hours. Recall when I mentioned the acid pocket. That acid pocket lasts for 1 hour, 30 minutes. It means any solution we are bringing must at least go beyond 2 hours. But Gaviscon does not give you 2 hours. It actually gives you 4. So it means if a meal takes an average of 4 to 5 hours to digest, Gaviscon can protect that meal. Apply that, you see that it's 3 times to 4 times a day. That means it protects you around the clock if you do TDS. You done? Okay, so now we are going to pour the water. Sorry, hello, sorry. You said 15 minutes left. 3 minutes, okay. So this is mimicking the stomach of an average human being. A patient is this way. So the acid HCl in the stomach is being replaced by citric acid. Now we have to give it the Gaviscon, and we see what happens when that occurs. Give the answers. As that is ongoing, we can see that it contains alginate, which suppresses the acid and also neutralizes the acid. Now, this is what happens when the patient is taking Gaviscon. Can you close the mouth? Thank you. You would notice when we gave the Gaviscon to the patient, it went straight down into the stomach. It went down into the stomach, creates an antacid effect, and then comes back up to form a raft on top of the stomach content. That is what stops reflux from happening. It now does those 2 things that we need to solve the problem. I think it's a good place to end the presentation, because with these 2 things, now we are clear that what solves gastroesophageal reflux disease is stopping the reflux from coming to the stomach and also treating the acidity in the stomach. Thank you. Any question? Do we have any question? I was trying to manage the time, so I just picked the salient points to show us. Okay? Do we have any question? I think in the absence of no question, we can take our leave. Thank you very much.
Thank you so much, Rekit Benkisa, for that wonderful presentation. We appreciate you. Next is APRN, Saving Lives.
It's supposed to be there. Acpn. once he starts, are you sure you'll be able to do? You don't have my slides. I sent it.
Don't worry. Let's just be sure that. Okay. Just wait.
I'm not sure whether you can link up.
So, hold your system.
Sorry? They're trying to load it. Can I go? Good afternoon, everyone. I crave your indulgence to stand on already established protocol. My name is Pharmacist Adeline Osakwe. I represent Saving Lives and Livelihoods Pharmacovigilance Project in Nigeria. My presentation is actually a public service presentation, not a company presentation. What did you do? I want to be looking at it.
Okay.
Yeah.
No problem.
Because I don't want to be turning back.
Can you just use this? Put like this. See?
No, I don't want to look
See?
back. I want to.
See? Just you move forward here. Good. Good. See? See it? Come back. Start. See it? Good. Just gently.
What did you do? I want to use my system. So, good afternoon, colleagues. I crave your indulgence, as I said before, to stand on already established protocol. The presentation I'm making is a public service presentation, and it has to do with pharmacovigilance. As you are aware, pharmacovigilance is or safety monitoring is one of the expanded roles of pharmacists in optimizing patient care. I represent Saving Lives and Livelihoods Pharmacovigilance Project, or SLL in short.
Sorry, there's an emergency. I need to make an announcement. Good morning, colleagues. If the chairman or any executive of Acpn Ogun State, chairman or any executive of Acpn Ogun State, please see me immediately. Thank you.
Can you? Okay, you can bring it. Okay. That's what I want to do. Okay. Sorry for that interruption. As I was saying, I'm making this presentation on behalf of SLL. And SLL is an initiative of African Union supported by MasterCard Foundation. Nigeria is one of the 14 countries in Africa that are participating in this pharmacovigilance activity. In country, we have 3 government agencies that are bringing their core competencies to bear on pharmacovigilance strengthening. And they are the National Agency for Food and Drug Administration and Control, the National Primary Healthcare Development Agency, and the Nigerian Center for Disease Control. What are we doing in pharmacovigilance? We're trying to integrate community pharmacists. We're promoting digital data collection tools, and we're also promoting adverse drug reaction and AEFI reporting. We're doing this by starting from points of weak pharmacovigilance to strong pharmacovigilance, doing a work of awareness creation, capacity building, and technology adoption. We have enumerated roles for healthcare workers and pharmacists to include detection and reporting of ADRs, patient education and counseling, collaboration with healthcare professionals, and medication error prevention, including contributing to pharmacovigilance research. We all know the definition of pharmacovigilance by the WHO and how we're including all kinds of drug-related problems under the watchful eye of pharmacovigilance. We have done some basic research to find out that there's gross underreporting of adverse drug reactions and adverse events following immunization. And we have noticed that pharmacists, as well as other healthcare practitioners, actually do not report as much as public. If you find that hard to believe, it's supported by statistics. So we need to really encourage ourselves to do the needful. There is challenge of poor ADR reporting, inadequate healthcare worker training, and limited public awareness. This segment of the presentation is to familiarize participants with the reporting tools and enable them acquire practical working knowledge of these tools. We are going away from the paper-based reporting tool to digital reporting system. We have the electronic reporting system, which is web-based individual case safety report management system. And this you can find in the NAFDAC website. We have the e-reporting platform that you can use. What all this does is that both the healthcare practitioners and the public can actually report directly to the database system. You don't have to report on paper and then have to find a way of sending it and then the person at the other end will now be the one to download and start imputing it. You report directly. The e-reporting form has the same phase as the paper report, but this one is electronic. We have mobile apps that we're promoting, which is the Med Safety app and the VG mobile app. The process of downloading them, they're clearly stated. You can download from your Android phone, the App Store, and so on. It does not require rocket science to do this. The same way, the VG Mobile, you have the system of downloading and then using it. The good thing is that you report directly to the database. There is no middle place. Now, call to action. What do we as pharmacists, community pharmacists, have to do? We have to take ownership of pharmacovigilance vehicle, invite all stakeholders, and drive it to ensure patient safety. We have to detect, report ADR, AEFI with appropriate digital tools today. We have to empower ourselves to function appropriately in this role. And most importantly, do no harm. There are some we may not be able to help, but there is none we should harm. In conclusion, I want to say that the expanded role of pharmacists in direct patient care includes medication safety. Pharmacovigilance provides the platform for continuous monitoring of medicines, vaccines in use through detecting and reporting of ADR, AEFI, utilizing appropriate tools. Even if you have tools that you're using, if they're not aligned with the national database, you have to re-strategize so that you'll be able to key in directly. Patient safety is a right which pharmacists should advocate for through effective practice. While pharmacovigilance is not mandatory by law for healthcare practitioners, it is an opportunity and a professional and ethical responsibility for pharmacists to add value to their practice and to build trust of their patients. I want to thank you for listening and hope that you take the immediate step to ensure that we all detect, report adverse drug reactions, AEFI, utilizing digital tools. Thank you so much.
Thank you so much, Saving Lives and Livelihoods Pharmacovigilance Project in Nigeria. We appreciate you for that wonderful presentation. Next in line is presentation by CPI. Thank you very much. Who's the presenter?
Just come and show me how to use the cursor. IFEADIGO, did I get it right? Many people think I'm Igbo, so let me use the opportunity to say that. Yes, indeed, light has come, and I give God praise for this opportunity to share briefly with you, and I thank our distinguished NC, the National Chairman of Acpn, for this honor and privilege and the support he has given this his baby, because we are presenting on the Community Pharmacist Assessment and Career Progression Institute. I'm sure you've been hearing all about that, and you've also seen it in some of the publications, but we want to use the next few minutes to talk about that and make it clear so that we know what this scheme is all about and we know how to key in. So good afternoon, the board chairman of ACPN, our living ancestors, distinguished fellows, elders, and colleagues. So today we are talking about CPA, CPI. And I bring you good news because it's all about career advancement for community pharmacists. And I want to urge my colleagues, community pharmacists, that we should be positive in our outlook. As we see a glass of water, let's see it half full rather than half empty. There are a lot of challenges around, but I want to urge us to look positively at have a positive outlook to life. So like I said, we bring you good news of CPA, CPI, and briefly I'm going to be giving you a background, talk about CPA, CPI, a brief report of the baseline assessment you very kindly participated in. We'll introduce the scheme to you, and we'll now talk about the progression scheme and summarize. So by God's grace, we'll try and do that as soon as we can. Right, by way of background, I spoke a little to that because we were supposed to have made this presentation on the first day, but thank God the governor was here and we have this opportunity now. So yes, before now, community pharmacists come into practice. Usually you resume as a superintendent pharmacist. Somebody said 40 years later, I'm leaving and I'm still a superintendent pharmacist. And for young pharmacists, there's not much in terms of career prospects and progression for them. And for many young pharmacists, they may love the entrepreneurship, they may love the direct opportunity to meet with clients, meet with patients, utilize the extensive pharmaceutical knowledge you have. But when they look at it and say, I may not even move, they go into other areas of practice. And then you also have pharmacists that have been doing so much over the years, and yet they are not recognized. It's like, who are you? I'm a community pharmacist. And you don't sound different from any other person. So the last ACPN Exco, like we said, they conceptualized it, and I commend Ifeadiago Oladigbolu for the idea during their tenure, and even more so our current national chairman for taking it up, and I say it's his baby now. So I congratulate you and I thank you for it. And based on that, there was a committee set up last year. We looked into the whole idea and came up with a draft. And by the grace of God, the current Exco now, led by Pharmacist Ambrose, have now decided that we're going to, he now instituted the Community Pharmacist Assessment and Career Development Institute. Okay, let me move on. Okay, some of the challenges and the opportunities, I've mentioned that. And what we're out to do, we want to retain talent within the profession. We want to promote societal recognition, very important. We want to elevate the standard. It is all about advancement. The standard of community pharmacy practice, promote professional development, promote business development, and improve patient care. In terms of, I've talked about the process, so I'll go straight into CPA, CPI. So CPA, CPI is a pioneering institution dedicated to evaluating, accrediting, and guiding the growth of community pharmacies across Nigeria, pharmacists across Nigeria. And we are created to evaluate, to support, and to elevate the practice of community pharmacy. Evaluate, support, and elevate. That's what we are all out here for. And this is our logo. Yes, you can have this, the logo of CPA, CPI. You can see ACPN. It's owned by ACPN, so that's the logo. It's green, indicating continuous growth, and round. So everybody is invited to be part of CPA, CPI. What is our vision? Our vision is to be the leading authority and catalyst for excellence in community pharmacy practice, assessment, and career advancement globally. And I say globally because we are blazing the trail. Nigeria doesn't always have to come from behind, but this time around we are blazing the trail, and even FIP is aware, and a submission will be made shortly. Our mission is to provide robust assessment tools, facilitate structured career progression, and support support cutting-edge professional development programs for community pharmacists. I'll be a bit fast because of time. Our objectives, the first one is assessment. We want to develop and implement standardized assessment methodologies. Take note of the word standardized assessment methodologies. Then we want to outline clear, achievable career progression pathways. Not pathways that will be like for them, those that we can identify with, those that we can achieve easily. Then we want to promote professional development, and we want to promote continuous quality improvement. Right, we are working with partners. And these are some of the partners we have, and it's very important because we're leveraging on partners to make sure that what we are doing is accepted and is of high quality. ACPN is the key. Of course, we're working with PCN, Safe Care PharmAccess. They've been so involved. They are ensuring that we are working according to international standards. We have Howard University Global Initiative Nigeria. They've been into pharmacy strengthening. They are with us. Center for Communication and Social Impact, PSN Foundation, NAPA, and PSN. And our partners are still growing. So we're open to more partnership. So these are some of the members of the team at some earlier meetings we have, and these are specifically the 10 people. I have to project this because for the last 2 months, we were only inaugurated in 2 months ago, work has been going on endlessly on CPA, CPI. So briefly now, the survey we had, thank you for being part of the survey. We're going to, if you have not been part of it, you still have an opportunity. We can still share the link. But so far, this is the report we have. We wanted to know, are pharmacists even willing? Let's not just bring something that is an idea of 1 or 2 people. Are pharmacists willing to be part of this? And we had the online survey. We had 182 respondents, and 61% are male. We had the superintendent pharmacists were 88.5%. We asked if they have completed any postgraduate training after your pharmacy degree, and 67% had not. Then we also checked the kind of practice, and we had about 92% were into retail and almost 8% wholesale. Now, to the age, you can see that it cuts across all ages in terms of the respondents. We have even we have people 70 plus, we have those under 30s, and so on. So it was good representation. We also had representation from almost 70% of the states of the Federation. If you have not made your voice heard, you still have the opportunity. Most of them, of course, are in the urban area, 58%, 35% in suburban. Now, this important slide as far as we are concerned. That's the next one. Now we asked, are you interested in enrolling in a structured career progression pathway? 98.4% said they are interested. Why are you interested? This is our response. Now, this was also very interesting because we'll think community pharmacists are only about financial rewards. But we saw that 85.7% are interested for the purpose of enhanced care and professional growth. Financial incentives and formal recognition came much later. Okay, and then we also saw that quite a number are willing for their premises to be used. Let me jump and go straight to the scheme. All right. So now let me introduce to you the scheme. So the institute was set up to actually bring up the scheme and ensure it is operationalized. So that's the Community Pharmacist Assessment and Career Progression Scheme. Let me go straight to, there are some areas we're assessing. Okay, the scheme is actually one that is supposed to it's all about professional development. It's all about recognition. is all about continuous quality improvement. What are the areas we're assessing? Briefly. Number one, we have years of practice as a community pharmacist. That would count, but that is not the only thing. Even if you have 50 years of practice experience and you have not developed, you may not be able to go beyond band 1. We have 5 bands. The band 1 is a community pharmacist. That's the basic. Then you can go on to being a senior pharmacist. Then you can go on to be a specialist pharmacist. Then you can specialist community pharmacist. Then you can go on to be a community pharmacy senior specialist. And the peak is the consultant community pharmacist. So we have those 5 bands that are defined. And we had actually subjected this into some various reviews and expert committees before we came up with this. Now, in terms of professional knowledge, that's the first area. We look at years of practice, then we look at advanced qualification. We encourage community pharmacists to continue learning. And that doesn't mean you have to have a PhD or a master's, even though it's encouraged. Short courses are there, PCN courses are there, WAPCP courses are there, and then the Institute will stand as a platform to encourage various capacity building programs, short courses that are relevant and can help our practice. Research is very critical, and we're saying that we expect community pharmacists to be more involved in research. We can start from just being an abstract at a conference like this. We can move on to full publications. But the Institute will also provide platforms to train or to encourage. Mentoring of students, very, very important. I was talking with Dr. Pounds and she was saying how important it is for us to stay relevant by mentoring. So that is in terms of professional knowledge. Then attributes, your licensure is critical. Digital tools, we talked about digital tools. We are going to be monitoring that. We want you to be, somebody said it's so expensive. It's more expensive not to have yourself fully engrossed in the digital transformation going on. Attendance at conferences, and also we have COPA. COPA is assessing your pharmacy. We're going to be assessing your pharmacy too. Sorry, please just give me a few minutes. We're going to be assessing your pharmacy. We have COPA, that is ACPN's, it originated in ACPN, and Howard worked with ACPN and PCN, and some premises are already accredited. We want to open it up. And we're working with PHARMACIST to now bring international accreditation to your pharmacy. And some people will say, how does that affect me financially? 2 ways. Number one, these people that are employed, with time, there'll be recommendation even for remuneration according to your bands. But you that you own a premise, like Lagos, for instance, they've accredited some hospitals, and I understand that even the insurance, they pay higher premium for those that are higher level. So finally, on these issues of what we're assessing, we're going to be encouraging specialization. I saw our colleague here specializing in menopause services. We can be vet medicine, it can be cosmetology, it can be compounding, it can be diabetes care, specialization, collaboration, pharmaceutical care, primary health care, and the rest. And we're also going to be looking at ethics, conduct, and finally, business development. So this is 8-star. I'm almost forgetting this. All right, sorry. Okay. I had left out the pointer. Okay, so 8-star pharmacist was the model, and this career progression scheme is bringing us to this, not just this 8, but the 10-star. In addition, agent of positive change, in addition, an entrepreneur. And we know that's what community pharmacists are. So we have scoring sheets, standardized scoring sheets. You don't have to have every criteria to move from one band to the other, but you need to, move. There's going to be a submission, and after the submission, you'll be assessed. So where are we? We have piloted, and I'm delighted to tell you that we have the first batch of the awardees today. The national chairman and the IPC are on their way. They are going to be presenting the awards to the first batch of the successful candidates. So going forward, what can you do? You can enroll. Once you enroll in the what do you call it, in the institute, you pay a token of 20,000 naira, you submit your criteria. In fact, the forms are going around. If you are interested in enrolling, please put your name down, put your contact down. We have a website that is ready, that is available, provided by SafeCare. So go to the website, indicate what band you think you are qualified for, and then we'll do an assessment. If you don't qualify for that band, we'll let you know what band you qualify for. Thank you very much. We are still here. You can ask questions, but I put it back to you. This is a new day for us as community pharmacists. So let's join the train. Let's join the winning train and ensure that we enroll in the community pharmacist assessment and career development scheme. Thank you very much.
Thank you so much, distinguished pharmacist, Dr. Ifeadiago, for this wonderful presentation. It's indeed a new day for community pharmacists. This project, which is key and apt at this time. Thank you very much for this wonderful presentation. Yeah, I know.
Thank you. Thank you very much, colleagues. Fellows of Pharmaceutical Society of Nigeria here present, elders of the profession, distinguished community pharmacists, ladies and gentlemen. This is our own presentation, SCPN presentation. And on our bid to continue to empower our people, this is part of the empowerment project. And I want to commend this committee of different discipline professors, consultants, and all that as we constituted them, and what they have done so far to assess these people. And this is what the NEC member, NEC and Council, and in our mid-year conference 2024, we all adopted this career progression project. And we have started the action on that. And they have done so well, and all of us have agreed that is a way for us to go. So on that note, we need to call those people that have scaled through in band 1 and band 2. And as he rightly said, we have presented this before the international community, and they see it as a new idea globally, and they have penciled us down for a presentation at FIP this year. And we needed to incorporate what we did today. You can see it's because of the time conscious and the presence of governor at the opening ceremony would have prayed the goodwill message from the FIP president. I think we need to pray it after this, then we'll start our town hall meeting. See Africa. See Africa. We need to pray just is about 2 minutes from the FIP president. So we need to pray that goodwill message. Then we'll call the members that have scaled through. Thank you very much for your work, man. Thank you, the community, the like of Professor Baka, the like of Dr. Lukbeju, Thomas, and many other members of the committee, Farmer Access, Huggins, and all that. Resolve to save life. These are the people that are collaborating with us to make sure that this becomes a reality. Thank you very much. Thank you very much.
Thank you, NC. Can we give the NC a round of applause? It's a unique thing that is actually piloting, and we want to commend you. Sorry, I thought we'll give our national chairman a round of applause. Thank you very much. We appreciate it. And those that they know they've qualified, can you come closer? I think you said you're taking. Okay. Okay, so we have some that have qualified for band 1 and band 2, and we have some others that think they qualify for higher bands, but because the initial pilot will only assess band 1 and band 2, we are welcoming them as members of the institute, so we'll also call them up and they would collect their certificates.
All right, so Pharmacist Francis Nwaize, band 1. Pharmacist John Abu, Senior Community Pharmacist Band, please come forward. Pharmacist Caroline Susanna, Please come forward, Senior Kanuin Pharmacist Band. Pharmacist Oluwaseyi Oluwole Charles. Band, please come forward.
Welcome. My name is Paul Sinclair, President of the International Pharmaceutical Federation, FIP. On behalf of FIP, I extend my warmest greetings and sincere congratulations to our member organisation, the Association of Community Pharmacists of Nigeria, ACPN, on the occasion of its 44th Annual International Scientific Conference being held in Awka, Anambra State. FIP is the global body representing over 4 million pharmaceutical scientists, educators and pharmacists through 158 national organisations and academic institutions worldwide. Since joining FIP in 2018, ACPN has been a valued member of our federation, contributing to our shared mission to advance pharmacy, education, pharmaceutical science and pharmaceutical practice. Your ongoing efforts to strengthen community pharmacy in Nigeria play a vital role in improving health outcomes and access to care. The theme of this year's conference, Technology, Integration and Personalised Care, the Future of Community Pharmacy Practice, is both timely and relevant. Around the world, healthcare systems are evolving, driven by digital innovation and an increasing emphasis on patient-centred care. Developments in artificial intelligence, personalised medicine and digital health technologies are opening new opportunities for pharmacy practice. Exploring how these tools can support more tailored, efficient and accessible services is an important step towards preparing community pharmacists for the future. Community pharmacists are often the first point of contact for patients, especially in underserviced areas. In a country as diverse as Nigeria, your accessibility and trusted role within communities make you key contributors to the national healthcare system. By integrating technology into daily practice,
Okay, thank you so much. That's the message from FIP President. So we continue. Senior Community Pharmacist Yahale Rabo Yenle, please come forward. Senior Community Pharmacist Kafaya to Badaru, come forward, please. Senior Community Pharmacist Band, Pharmacist Erewu Otoi Billy, please come forward. Community Pharmacist Band 1, Pharmacist Godfrey Felix Okoli, please come forward. Pharmacist Lawa Olakwejo, Community Pharmacist Band 1, please come forward. Pharmacist Agbonma Emanuela Esom Ibe, please come forward. Pharmacist Ikechuku Christopher Okafo, please come forward. Yes. Okay. Pharmacist Tolulope Ajayi, Community Pharmacist Band 1, please come forward. Thank you so much. Please applaud these ones who have voluntarily submitted themselves for assessment, and they have been found worthy for community pharmacist band 1 and senior community pharmacist. So, thank you so much. Bye.
Congratulations. We can now proceed with our town hall meeting. Charles, can you help me with a brochure there?
Good afternoon, distinguished colleagues, past presidents here present, fellows of the Pharmaceutical Society of Nigeria. We'll go on to a most important session today, which is the town hall meeting. And we respectfully invite a past president, a living ancestor, the BOT chairman of the Association of Community Pharmacists of Nigeria, Pharmacist UNO Uwaga FPSN, to chair this session. Please, can we appreciate him? Please, can we appreciate the BOT chairman, Chief Dr. UNO Uwaga FPSN. Wish to invite the Registrar of the Pharmacy Council of Nigeria, Pharmacist Babashehu Ahmed, FPSN. He will be represented by Pharmacist Thomas Ilukweju. Please, can we appreciate the representative of the Registrar of the PCN? You're welcome, sir. Thank you. We also want to respectfully invite the Director General of NAFDAC, Professor Mojishola Adeyeye, FPSN. Please, can we appreciate the DG of NAFDAC? Please, I wasn't given the name of our representative. I'm sorry. Good afternoon, sir. Please, can we appreciate them as they come up? Okay, the Director General of NAFDAC is here represented by Pharmacist Louis Madubata. Please, can we appreciate him? And then the first son of PSN, Pharmacist Eze Ambrose Igwekamba, the National Chairman of the Association of Community Pharmacists. Please, can we appreciate him? And I'll hand over the microphone to the chairman of this session. Thank you.
Sorry, I was telling them that there's no way I can sit down and address distinguished pharmacists of this caliber. So I decided to remove the technology thing and continue with the microphone. Let me sincerely welcome all of us. I would prefer to grade us the ancients, the medievals, and the young pharmacists. So many things are going on, so many changes are taking place. I just watched the last one here where the pharmacists are being graded different from what we used to know and do. But we want to thank God that all this is happening in our time. Now I can recall the whole idea of town hall meetings. I can recall that in company of past President Ahimen way back in 2006. It was our last year in the presidency of the PSN. And the whole idea was that we should create a platform, an opportunity for pharmacists to air their views. Because if you look at the AGMs, the time is limited. The time usually is limited. And you find a lot of pharmacists feeling very frustrated even after the AGM. So we came up with this idea of town hall meetings. And it's been really, really great. It's been so good. It gives you the opportunity to ask questions, get clarifications, get more knowledge of your practice. It's a bit of what happened with the regulatory officers. Yesterday I was trying to say that please listen to them and make sure you don't break the rules. Much as we ask them, we also make sure we don't break the rules. Now we have another big opportunity today. It goes beyond those who are sitting here. I know that a lot of information is going to come from the national chairman, and then a lot of information, regulation is it. A lot of information is going to also, in addition to what they did yesterday, we have this opportunity, but I want to plead with us, and indeed, other questions you can ask within the time that has been allocated today. But please don't abuse it. If you talk too much, I will stop you so that others can have the opportunity to also express themselves. Maybe not all of us. At the end of it all, it will be that your curiosities, your anxieties, and all that troubles you that you want to know will have been satisfied. So tomorrow when we sit in AGM, it will be business. It will be real business. It will be pungent, we'll go straight to the point, and we will not spend the whole day here as we prepare to have the banquet. So distinguished colleagues, the town hall meeting for this year, ACPN, is open. Now, how do we go about it? You will ask your questions, but notwithstanding, it might be necessary for the national chairman to set the ball rolling. There are so many things he may want to tell us that will satisfy your curiosities or the questions you want to ask and all that. If he does, please, you don't have to speak again. You don't have to. It's not, if one person talks what you want to, or the questions you want to ask, the chairman has addressed it, you don't have to. It's not necessary. The same thing when our regulatory officers will also speak to us. They will answer your questions. We'll try to take down, and for those who may not have the opportunity, please write it down and pass it through our compares. It will come to us, and we will also try and ensure that those questions are attended to or answered before the close of events for this program. Once again, distinguished colleagues, the ancients sitting before us, the medievals. I think many of us are now in the medieval. And then, of course, the younger pharmacists who are all here. Let me, on behalf of Mr. Chairman, welcome us to the 2025 ACPN Town Hall meeting. Thank you.
Thank you very much, my BOT. Distinguished colleagues, today is going to be a remarkable day. Today we are having our first town hall meeting, and the basis have been presented historically by our BOT chairman, Chief UNO Uwaga, FPSN MNI. I appreciate you, sir, for all the support for the ACPN and the pharmacy profession at large. My statement today is going to have like two sections. And I present before you our regulatory agency here, because Council is here, NAFDAC is here, and they are the hit and the major people that regulate and control our practice from school to our practice, as I said. And a lot of burning issues that we're supposed to discuss or questions we raise, especially at the council level. This is an opportunity for you to throw some of these questions to them. And I believe what bothered us so much in practice environments and regard to PCN, PIC, cases here and there. If all those questions you used to raise during the NEC meeting, you can easily ask those questions here. I also know what bothered us much as regard to NAFDAC on the issue of orphan drugs, service drugs, which most of our clients are clamoring on, and who, in a slogan to protect them, we must have those available to our premises so that we'll be able to help the humanity. I know you raised that as also a question. Our new sign at the National Secretariat is another big issue, which I know most of the states, apart from Lagos and a few other states, that are complying with this patented document we're supposed to be using to signify to the public the genuine premises. I know last year there was a delay in the production because of the cost, and NEC, in her wisdom, took a decision at our first NEC meeting in 4th December 2024 to start the production henceforth. And the new signs are available, and we're also looking forward to declare October this year as an emblem day, so that all of us as a community pharmacy should be able to have one emblem instead of all the fakes we see here and there. Let us begin to distinguish ourselves on that regard. Our implementation plan are there, which I also have showcased to the our NEC member, which were adopted, that we're also going to follow the issues as regard to sticking to our agenda. There's a lot of other issues I would like to present before us, so that if I sit down, we can do, other agencies can do their presentation, and the question can come around. And let us listen attentively. A lot of people are walking around, walking from one place to another. Please let us comport ourselves so that this town hall meeting will be a productive one. There's a lot of other things, development in our CPN at the National Secretariat, which I want to present before us so that people can also get clarification and be informed on what is going on at the National Secretariat. And one important one that has been giving us a lot of concern, which we are trying to manage in our wisdom, is the development at FCT branch, which I would like to make a concise presentation. I decided to put it down in black and white so that it will be very concise and brief, so that before AGM we'll be able to take our decision. Attention of the National Secretariat of ACPN was drawn to some challenges associated with the elections of a new state executive committee following the end of the PHARMACIST Ahmadiyya-led ESCO. Some of the petitions given to the provisions were directed to the National Secretariat by some of the aggrieved aspirants.
Sorry, Mr. Chairman. I want to appeal again. Please sit down and listen. Town hall meetings are usually a serious matter. Don't distract others. So sit down and listen. The chairman, the national chairman is trying. When we go for FIPs and all that, nobody does what we are doing now. Everybody is absolutely quiet and listens. Please try and sit down and listen to what he is saying, because that might mean you're asking more questions or being satisfied with his presentation. Please sit down and listen. Give us that respect. My friend who is standing there, somebody, please sit down. God bless you.
Thank you very much, my fellow. As I was saying, I said some petitions, given the provisions, were directed to the National Secretariat by some of the aggrieved aspirants to the Executive Committee who are disqualified on various grounds. And the XCPN National Chairman and NEC, and in accordance with the provision and the Constitution, whatever decision we are taking, I would like us to always have our Constitution we need to protect and we need to implement, and that is a constitutional provision, as we all know. And our Constitution, in accordance with the supplements of the Constitution, we should always try to adhere to that. And this Constitution and its provision shall be binding in all community pharmacies, all community pharmacists, no matter their ranks or their status notwithstanding, state branches of the ACPN, including FCT, organs and affiliates of the association. So the national chairman acted. The national chairman of the ACPN rely on the section 35, which I just read in the Constitution of the ACPN Constitution, which points it area the Constitution and the provision shall be binding on the following. Number one says state branches of the ACPN, including FCT and other things I've led. The chairman looked at when things are coming, and when I started to receive petitions since February 24th, the HRH national chairman looked to Farm Amadi Enejo, the outgoing chairman of FCT branch, to stay action on the AGM of the branch selected at the time for March 27th March 2025. Why did I take this action? Because at our first NEC meeting on 4 December before my inauguration, there's already an existing crisis in Akwa Ibom State that had wanted to intricate the PSN conference, and the national chairman and NEC at our wisdom decided to wade into that and stop the actions that was going on that would have brought a lot of conflict at that state. So based on that, and there's already another crisis somewhere in Kuala State, which we are also managing before then. So at our first NEC meeting, we inaugurated a two-committee, conflict resolution committee and litigation and constitutional review committee, knowing well that there are some loopholes at the constitution, which the ESCO presented by the NEC, and we wanted a situation whereby before any of our members will sit to court, should be able to consult a committee that can guide whether it's necessary or it is not. And a conflict resolution committee, because there's already a crisis, and we wanted them to vade into making peace so that we can continue. So that was done by 4th December. Amadi, however, wrote back to say the intervention of the National Secretariat had been overtaken by the events because of the appeal committee of Acpn FCT branch had approved the disqualification of the petitioners referred to by the national chairman. The letter of the outgoing chairman of the FCT branch was very contemptuous of the office of the national chairman. Despite the hostile posture of the Ifeadiago Amadi, the NEC do set up a three-man committee, and I already stated here, comprising distinguished committee pharmacists and fellows of Pharmaceutical Society of Nigeria, the like of Abombe Esomibe PSN, Ade Boyega Ogutoya PSN, who is the national vice chairman, and pharmacist Lawrence Ikaito, who was the secretary of this committee. The committee didn't enjoy the cooperation of the Amadi Enejo-led outgoing ESCO. They come up with some recommendation. On March 21, 2025, the national chairman summoned an emergency Zoom meeting to review the development of Acpn FCT Abuja. Key resolution at this meeting includes that Enejo was directed to withdraw court cases. He had instituted to pave way for holding an election on 27th March 2025 at the Abuja High Court because he didn't explore any internal conflict resolution mechanism. Because the conflict resolution mechanism we are saying here is our conflict resolution committee who have already sent to Abuja in advance. And when they got there, the Amadi-led team and some of the others who wanted them to see become incommunicado, that they couldn't get them, claiming they were not informed and all that. Despite that, the committee still stood on ground and do their work. And they come up with this resolution. He was subsequently directed not to notify the National Secretariat at the intention to suspend the AGM of 22. AGM they intended to do on March 27th, pending the resolution of all the encumbrances connected to the AGM, latest by March 24, 2025. And I shall never be activated by the then chairman from Amadi Enejo. Following the refusal of Amadi Enejo to suspend the plan for the March 2027 AGM, the report of the three-man committee was forwarded to the BOT of the Association of Community Pharmacy based on constitutional provision. And if you have our constitution here, and you go to the functions of the ESCO, NEC, BOT, that board of trustee, if you go to Article 9, section trustee of the association, 1, 2, the trustee may hold office, okay, no, not this one. Section 3, subsection sorry. Yeah. Section, yes. 22nd, 4, subsection 1 and 2. The Board of Trustees shall have the following function, that is to arbitrate in conflict between members, state branches, parties within the association. B, take in charge of the association property in times of crisis. Advise the NEC whenever the need arises. And D, hear appeals for members of state branches on issues that bordered on what? Election. I just want to specify why the matter was referred to the BOT. So following on the refusal of Amadi to suspend the election that we tended to do on 27th of March, 3-man committee about conflict resolution committee submitted a report and we forwarded to what? To the BOT in accordance with this provision in our constitution. The BOT of ACPN met on Monday, March 24th, 2025 via Zoom. Some of the relevant highlights of the BOT meeting include the BOT dismissed the two of the petitions and upheld 3 of the person's petition based on the relevant section of ACP FCT bylaws. The BOT noted with concern that Ifeadiago deliberately chose to ignore the statutory position spelled out in the ACPN FCT bylaw, which provide that past chairman of the branch be constituted into an appeal committee to review election petitions or conflicts. The latter set up an unconstitutional 3-man appeal committee to usurp this statutory role of the past chairman of the FCT branch. Just as we stated here, in our constitution we have committee of past chairmen, and in each of the branch have committee of past chairmen, where if there's any issue or crisis here, a matter should be referred to those committee of past chairmen in a various states. So as an elder, they will be able to use their wisdom to intervene in that regard. And that was the directive of the NEC, and that was the directive of the BOT as put in their report, which he couldn't meet. Rather, he constituted a 3-man committee. On that note in the petition, the FCT Committee of Past Chairmen generated a petition to the national chairman as well. The BOT, in appropriate alignment with the provisions of CAMA 2020, as amended, directed that only as per and recommended by the BOT, after reviewing all petitions, in addition to those cleared by the screening committee, be allowed to contest elections, supervised by the National Secretariat if it would eventually. The BOT recommends the election should hold 30 days after it released its reports. The BOT condemned the result to litigation by Ifeadiago because internal conflicts make reason were never utilized. In line with the due process and norms in the ACPN, the OBOT counsel that if Ifeadiago refuses to meet all the terms of the resolution that compel him to show clear evidence, he has stopped the plan AGM of March 2027, March 27, 2025, by the end of the deadline fixed by the NEC or the ACPN, that the NEC of the ACPN should suspend the branch from NEC, where appropriate disciplinary action and other steps inherent to the instituting a lawful platform in the ACPN SC branch is embraced. I don't know what I would understand what you are saying here. This report, after the 3-man committee have submitted their report, we had an ESCO, we had a NEC meeting, emergency NEC meeting, and they were given 72 hours to withdraw the case in court, as the BOT report have upheld and suspended some of the people that wrote petition ab initio, and they should adhere with the report of the conflict between the BOT committee. If he fail, that disciplinary action and suspension, the NEC have already proposed, but gave them 72 hours to adhere to this resolution if they meet up with that. The BOT frown at the shady stewardship responsibility at branch level in the ACPN as witnessed in the FCT scenario. Moving forward, the BOT directed that ACPN PSN external auditor be mandated to audit the finances of ACPN FCT branch. And also, the BOT evaluated the spirit and the language of the correspondent of the ACPN FCT branch chairman, Pamameja Amadi Enejo, which reflected obvious insubordination to the national chairman. The BOT therefore demanded an apology through the chairman of BOT to the national chairman of ACPN. On April 11, at the ACPN NEC meeting, a review of the compliance and adherence to its directive by the immediate past chairman of ACPN FCT was undertaken, and it was discovered that all the directives of the NEC were both flouted and violated. I want to remind us here and state categorically the steps the ACPN, ESCO, and NEC have taken. The first NEC meeting where Amade was presented and the secretary also was in the NEC meeting, and a decision was taken. Report of 3-man committee forwarded, presented to the BOT. The NEC on her wisdom appealed to Amade, please withdraw whichever case you have instituted at the High Court in FCT and adhere to the directives of the NEC, which you couldn't meet up. Also the BOT report came out, and also we had another second meeting where we waited for 72 hours and he was not able to meet up with the directive, and FCT Abuja was what? Suspended. NEC on her wisdom still begin to work on how to still go back to the internal mechanism if they might have withdrawn the case from court. Still from March till April, when the NEC have another pre-conference meeting here in Oka, and this is the resolution of the NEC. The NEC of ACPN, after careful appraisal, resolved that all committee pharmacists purportedly elected at the illegitimate AGM of March 2027 and those connected to it be disciplined by the ACPM and refer for further action at the PSN. A caretaker committee that was inaugurated where there's already a crisis. The NEC, on her wisdom, reinforced with the addition of 2 NEC members set up to manage the affairs of the ACPN-FC branch, which includes, with a specific charge, to organize a constitutional-backed election for ACPN FCT. Based on this communique and resolution by the NEC, on 17th May 2025, the ACPN FCT branch election was held as scheduled by the caretaker committee and NEC. At the end of the election, the following members were elected. Farm Chima Eze Madekwe, DC Farm FPSN Chairman. Farm Hyacinth Onyema Eze Vice Chairman. Farm Joseph Iya Eko, Assistant Secretary. Farm Nkechi Azuekwe, Treasurer. Farm Casey Cypress Inyon, FinSec. Farm Chairman Weze, Publicity Secretary. Farm Basil Anekwe, Editor-in-Chief. Farm OK Oka, Internal Auditor. This, the summary of what has transpired at the National Secretariat and Abuja. And based on this, at the last NEC meeting, which the one we held before this, before a pre-conference and a NEC meeting, at this conference, the elected executive members of FCT, based on this flowing process, based on this due process, recommendation of ESCO, or recommendation of the NEC, and resolution of the NEC in 2 occasions, and the BOT, this was presented to NEC, and NEC have ratified this, and I feel it is right time for us to present to the town hall meeting where, if there's any question, we can answer, and the clarification will be available. And in view of this event, catalog above this NEC or the ACPN, and I presented this process leading to the election of these new ESCO members of FCT branch and members, the executive committee on our wisdom field will present this for ratification and affirmation as we proceed. Tomorrow, at the end, we'll be able to understand what is happening in the National Secretariat, and all of us will be aware. I know a lot of things have gone in the platform, and we know. And in our constitution also, we know what will be presented also. That's a constitution which will follow the normal due process presented to the NEC, have been ratified by NEC, that will also going to be presented at the AGM. And the need, because if you go to our constitution, Article 8, where we have standing committee, we have a disciplinary committee. And in disciplinary committee, if you go to ad hoc committee, there's a process through which we present a case to a disciplinary committee, which ESCO, in her wisdom, presented before NEC, and if we should align our constitution in accordance with the PSN, which is our parent body, the committee, disciplinary committee, as an standing committee, as we have in our own constitution, we're supposed to have an investigating committee. Investigation committee that will be enshrined in the constitution, and as a process through which an investigation committee operates in PSN, and as a time, a period they work and investigate and present whatever is their report to the disciplinary committee for further action. So these are the things NEC on her wisdom has also agreed and adopted that section, amended that section for us also, for our information, and for all to be aware as we proceed in our AGM tomorrow. Thank you very much for now.
Thank you very much, Mr. National Chairman of ACPN. Now, if you listened attentively, you will see the trajectory of this matter up to this moment. I know that some people have reached me to say that the matter is in court. Therefore, it will be sub judice to discuss it. Let me make some clarifications. We do know that, what's the name of that chap again? The outgoing chairman. Yeah, we know that Enejo and Co. went to court. The matter, lawyers only filed it. No appearance has been made. No statement has been made by court. No injunction has been given. Nothing of such. So I want to assure us that we can discuss it. I will not be breaching the law of the land. So it's just for those people who met me and tried to talk about it. So I just want to clarify that point. It will not be sub judice if we discuss. It will not be sub judice if it comes up tomorrow at the AGM, and so on and so forth. Nothing yet. Lawyers only just filed it. We hear that a certain judge will, but nothing has been pronounced. So you can ask your questions. We will try to answer them. And like the chairman said, I think by tomorrow there should be, the AGM will sit on the matter and make her decisions. Really, it is all about say what you did was right or it is wrong. And that is what we call ratification. So let me assure us that we are not doing anything to the contrary. None of us will be taken to prison after this AGM. Nothing like that. No sub judice of any nature. Let me also, one of the things we don't understand about the ACPN is that, like it was being said, it's the first baby of PSN. And according to the PSN constitution, the constitution of PSN is supreme. But we also have to note where we have placed ourselves. ACPN is registered under the CAMA Act, or the Companies and Allied Matters Act, as amended in 2020. I will employ us. You don't really have to talk too much, but when you read it, you will understand where actually we stand. And for those who talk about BOT, there's no name they have not called the chairman and all that. But I don't know whether I read that law very well. I also read the PSN, the Constitution, very well. So I don't know where we have flouted. I also know that the PSN president has tried to mediate. But this other group, they are so adamant. I also want to point something out. By the PSN Constitution and by the CAMA law, the Companies and Allied Matters Act, there is only one election the law will recognize that there was only one election that took place in Abuja, and that's the one conducted by the PSN. Go and read it very well before you start talking much about it. So I want to clarify this so that we don't go into too much, On that note, I would like to get your comments, if at all, so that we can move forward. Oh, okay. The government of Nigeria, as represented by these two persons, they are really eager to catch their flight. So let's not break the discussion. Just take your notes and the laws will come. The questions will be taken so that the ones that concern them will also, they will answer it and then try to catch their flight back to Abuja and Lagos. So, I believe that yesterday they did most of the talking. It is for us now, if we have any questions, let us ask so that they will further clarify what really transpired yesterday, or anything that is worrying your mind, they will be able to answer it. So, I think we can go ahead. They don't have to say, do you want to make any? No, I don't. It's for them to ask questions. Yes. So, they are also saying that they tried to clarify a lot of things yesterday and that they can now take your questions. So, the questions can come from my left, from the hall, for my left or for my right. And then the point really is anyone that is not clarified, there are many elders here, past chairmen of both PSN, ACPN, and all that, that can also enlighten us. We are not claiming that we know everything. So on that note, we can start taking questions. And we can start from my right to the left. Yes. We are now open for your questions.
The National Publicity Secretary here. Okay, come and help us with Mike in case. I wanted to ask a question to the PCN on regard to online pharmacy.
Okay, please go on.
Please, on regard to online pharmacy or pharmacy, our member need to understand, explain more in detail the existence, if the online pharmacy, like my pharmacy is Rosemont Pharmacy, if I open an online pharmacy, as the question they are asking, in the name of Losmos, and I've already paid my dues as regard to my premises, am I still going to pay for the online own? Second one, am I still going to get a superintendent for the online own? Or whether my own will cover my online pharmacy? I know a lot of people have asked this question, please.
Thank you very much, Mr. Chairman. To go straight to the answer is to say that, yes, there will be need for a separate or different superintendent pharmacist for the online pharmacy. And that the online pharmacy is another business of its own. Any infraction by the online pharmacy the sanction for that infraction cannot be visited on the pharmacy, the brick and mortar pharmacy. So the answer to those two questions are that, one, the online pharmacy is a business of its own, entirely different from the brick and mortar pharmacy. Then the superintendent pharmacist to each of the businesses must be different, in line with the provision of the law.
Thank you very much. Let me just to help us and to help the PCN to make us understand it more, I will ask that the PCN takes time to develop the conditions, the regulations, and all that has to do with that, so that we shall read it in black and white and understand it, because right now people are still wondering exactly what it is. So I think that is one of the take-homes that our director of PCN here will ask him to take home to the registrar. Yes. You want to speak? Please, questions. Ask your questions. This is a town hall meeting. If you are shy to ask any question, please write it like yesterday. Write it and bring. Just pass it through our compass there. It will reach us, and they will still answer it.
Okay. Thank you very much for this great opportunity. Thank you very much, the National Chairman and our fellows here in the House. My name is Ifeadiago. I'm from Akwa Ibom State. In the last 2 months, we had PCN enforcement team coming to Akwa Ibom State for enforcement. And after the enforcement exercise, there was a particular statement that the leader of the enforcement team made, which I want a clarification. He said that one of the reasons for sealing some premises in Akwa Ibom State was that they were carrying out clinical practice. I was not that comfortable with that term. So I want to find out, what does PCN mean by clinical practice? Because I am made to understand that I did clinical pharmacy in school. So what does it mean? Is it, I don't know. I would like to know what they mean by clinical practice.
What do they mean? They came on raid and they declared that there were some illegal practices for which they shut down some premises. What do they mean by that? No. It will be expanded. He will address the issue.
Then the second question I want to find out is that what is the place for the State Ministry of Health in regulating community pharmacies?
Sorry. Okay. What is the place of the State Ministry of Health in regulating community pharmacies? Okay. He has noted it. Yes, sir. I can see your hand. Can you give him the microphone? Thank you.
Thank you very much, Chairman and the House. I just want to give like a rider to the comment of the National Chairman earlier on the Superintendent Pharmacy status for online pharmacy. We live in a time where there is clear scarcity of manpower in pharmacy practice. And I know that laws are made for men, men are not made for laws. I want to appeal that PCN will still have a rethink or a review of that provision for us to have a separate superintendent pharmacist for the online pharmacy, instead of having, because we have a situation where we're in a digital age, and practically what you do in your brick and mortar premises is just like a platform for what you also do on the virtual platform. So it's very, very possible, because usually we've had situations where superintendent pharmacists are idle, not fully engaged in the brick and mortar assignment that they. So we can have a situation where the same pharmacist handle both facilities. Two, in the area of manpower, we want to appeal to PCN to do all that needs to be done to liaise with the Federal Ministry of Health and other relevant bodies to ensure that our state PCN offices are well manned, so that we don't keep having this excuse of low or shortage of manpower as a reason why we don't have full oversight of premises, be it wholesales or retail, across the entire country. And
we have heard you. Thank you.
Finally, sir.
He has noted that.
Finally, sir, we want to appeal to PCN to please take a very firm position on this perceived loose or weak approach to the oversight of what the wholesale premises are doing. The impact on retailers is too heavy, and many of our colleagues are shutting down. Very, very important. Thank you.
Thank you very much. He's noting it. Yes, please, all those who want to speak, because I'm being reminded that some more programs are coming up. Please, can you just come out and not more than 2 minutes? Not more than 2 minutes. Can you just come out so that we see you, so that we don't ask our distinguished lady pharmacists to be walking about everywhere? Just come out, not more than 2 minutes. And I also want to let you know that some of the questions that were asked yesterday will be answered today by the PCN and possibly by NAFDAC, because we didn't have all the time. That is why you cannot speak for more than 2 minutes. I will stop you. Thank you very much.
Okay, thank you, sir. Biola Polosi, FPSA. My question is to the registrar. I want you to further clarify on online pharmacy. For every online pharmacy, must there be a brick and mortar? Because I've been on platform where online pharmacies were being promoted as if it's hanging alone. This, just like you have said, there should be this, there should be that on brick and mortar. I think you also need to tell us what is the law. Is it something hanging alone? Because at your presentation years ago, it was said that every online pharmacy must be attached to a brick and mortar pharmacy. Please give us that.
Thank you.
Thank you very much, the chairman. Mine is to the NAFDAC representative. A lot of activities, especially at the closure of the open drug market this year. And I want to commend the DG of NAFDAC for such activities. And I want to ask, during this period, even till now, do you feel you have adequate support from other stakeholders? Let me say the PCN, judging from last week, I read that the NAFDAC is planning on registering, will I call it, open drug market perpetrators. So, do you feel you have enough support from pressure groups like ACPN, PSN, and even PCN in this fight, ongoing fight you are? Because NAFDAC, for some time, it even led to a situation whereby DG of NAFDAC was summoned to the House of Rep. On social media, NAFDAC was being mocked, and I didn't see any support from other stakeholders to make sure they rally around NAFDAC in these difficult times. Thank you. And of course, secondly, I don't know, talking about the case of Abuja, I don't know if the case is in court, but whether ACPN have been served. If ACPN have been served and they have the knowledge, would this notice of service, with the notice of service, can it still say that the issue of contempt does not arise in this case? I'm just asking prejudicially without, if it is an ignorant question, it should be stated as a bet. I just feel concerned. Thank you.
Thank you very much, Mr. Chairman. My name is Dr. Jerry Nobet Felix from Far East Imo. My question is very simple and it's directed to the registrar. So I'm a little bit worried about issues that concern the PIC that is supposed to be inspecting the pharmacies in the hospital. This has been discussed severally, and I'm a little bit bothered that PIC in the various states are doing the much they can to ensure that there is sanity in the community pharmacy and PPMVs. But from the point when this particular Pharmacy Act was brought into bill to accommodate inspection of community pharmacies, we've always asked for this particular committee to be set up. And the registrar has always promised that the committee that will be inspecting the pharmacies in the hospital will be set up. I don't know what is holding that. We are eagerly waiting for a time when we hear at the various states that this committee has been set up. That is on one side. Then on the other side, to the national chairman of ACPN, our own national chairman, I just want to say this. There is a burden that you must carry as it concerns the relationship. This was said on the opening ceremony. The relationship between ACPN and NAFDAC. A lot is going on. And quite unfortunately, most persons in NAFDAC don't even know the difference between service drugs and orphan drugs. They don't even know what it is. In Imo State, we had that experience, and it was very painful. And what I realized is that at this point, we must start working to ensure that pharmacists are recruited to be state coordinators or state directors of NAFDAC in the various states so that they can direct the activities of NAFDAC aright. Thank you very much.
Good afternoon, everybody. My name is Pharmacist Simo Bonekudon from Akwa Ibom State. I have 3 questions here.
Please.
Okay, one is when the PSN staff, pharmacists came to Akwa Ibom State for inspection, the way they treated us, they treated us like criminals. The PCN people came to Akwa Ibom State and mocked us as if we are criminals, as if we are not their colleagues, or as if we are just chemist people. In short, the chemists that were beside pharmacists, they saw the premises that were chemists. I mean, patent proprietary vendor medicine close to the pharmacy that is not even equal to the distance that is calculated by the PCN, but they overlooked that place. But they came to pharmacy outlets and even round us up, embarrass us in front of our staff as if we were just people that are not even qualified to own a pharmacy. That's number 1 question. My number 2 question is about the ministry, about the position of PCN in this clinical pharmacy practice. Because I'm a member of CPAN. I've been trained on drug administration, immunization, and vaccination. But the way the PCN staff treated us like it was as if we are not even, we don't know what is going on in this vaccination, parental drug administration, and every other thing that concerns PCN. My 3rd question is about the Ministry of Health. Is the position of the Commission of Health to regulate pharmacy practice in Akwa Ibom State? What is the stand of the PCN about that? Thank you very much.
Thank you, Mr. Chairman. My name is Pharmacist Nengi Losin, ACPN River State. Since my colleagues have touched on certain parts of what I wanted to say, mine will be like recommendations. We also had the PCN enforcement team in River State, and truly we were not treated properly. So my recommendation will be that the enforcement teams should have a cordial relationship with the states in enforcement, because they are not coming to kill us, they are coming to support us. We also applaud the positive aspects of their work, and we are willing to support them effectively to get their goals done. My second recommendation will be to our national chairman, Pharmacist Eze Ambrose, about the legal issues, the lessons that have been learned or we are learning from Abuja should be used to develop protocols and recommendations to states on the paths they will take when some of these legal issues start from the latest basis, so that we don't get to such points as this. So the disciplinary committees or whatever committee that should be written to in the instance this issue start should be clearly spelled out, and member states should know that. Then I go to the question, does the PCN enforcement team operate without clear guidelines for categorizing offenses before sealing pharmaceutical premises? The requirement of 5 years post-graduation experience for a pharmacist to qualify as a preceptor in an internship center may need reconsideration, especially since the pharmacist serves as a trainer and interns are not expected to operate independently. These are 2 questions for PSN. Thank you very much.
Thank you, everyone. My question 1 to NAFDAC and then to PCN. During the time of Professor Dora Akunye of the blessed memory, I understand that during registration of products are coming from US, UK, they don't tell the pharmacists registering it to pay money for them to go for inspection. But I'm surprised that currently, if you are registering a product from US or UK, product that passed through FDA, NAFDAC here will tell you to pay like between 10 to 20 million for them to go for inspection. For some of us that are young pharmacists that are coming up, if you can use such amount to pay for only inspection to US or UK, how much do you have to pay for the product you are bringing in? Please, I urge with NAFDAC, they should please look into it, except if they don't want young pharmacists like us to come up. That is number 1. Then another one is this issue of online pharmacy. Please, it's of my opinion, because it's as if it's contradicting what we are taught yesterday. Digitalization is all about online pharmacy. If you are talking of digitalization, if I'm in brick and mortar, I can decide today to come on, open up a website, it's online pharmacy. Automatically, it's an online pharmacy. So how will I now go and employ another pretending pharmacist where I'm there to take care of it? Please, PCN should please look into the matter. That is just what I'm trying to.
Good afternoon, everyone. My name is Pharmacist Clementine Awasoro, representing Acpn Bauchi State. I have 2 concerns here. Number 1 is that the pharmacists in academia and in civil service sector, they are not allowed to register a premise. When you come to the field, their counterparts, all the nurses, all the doctors, all the health technicians, they are given the opportunity to own.
Please, let me stop you on that question. Go and read the law. Go and read the pharmacy law. So what you are trying to say is an old thing. So let's hear some other, go and read the law.
Okay, sir. Then again, it's conference bags. Everybody here or some people registered for this conference. So it is expected that anybody that registers for a conference, no matter where you're coming from, should be entitled to have a conference bag. Some of us that have people that sent us here as delegates, they told us that when we go there, collect our items for us. But you find out that most of the pharmacists here did not get those items, how much less when we get back to the community. Thank you very much.
Thank you.
Good afternoon, everybody. My name is Bemoipri again, pharmacist. Bemoipri again from Bayelsa State. One of my concerns is what are the criteria of reopening a premises that have been sealed? I'm asking this question because just of recent, just a week ago, the enforcement team came to Bayelsa State and several premises were locked, both patent and pharmacies premises were being sealed. And before we know, even before the enforcement team left the state, they have already started, they have reopened again. And some of these premises, they have a notable issues where they have not registered since inception of that premises. They don't have superintendent pharmacists in those places, but yet within a few hours, the place have been reopened, those places have been reopened again. So is it that the enforcement team, is the enforcement team that reopen those premises, or they reopen those premises by their own self? That is one thing we want to know, because so many things are happening in Bayelsa. So we are even asking that enforcement team should be coming as regular as they could. Then the second thing again is that what is PCN doing concerning patent shop? Why am I asking this? I'm asking this because every junction, in between junctions in Bayelsa State, you will see patent shop, and there are young pharmacists coming up every year. They are graduating pharmacists every year, and when we are about to come in to open our own place, we will not have any space again to open premises. So what's PCN doing concerning these people? Then the last one is we have been having some programs that are enlightening us to become relevant with our sisters' profession and even with our clients. I've seen that after we have paid for some trainings like point on care testing, we have done that. But could you believe that when we get back to our place of practice, when we are carrying out this text, these med lab people, they will come and say that, why are you carrying out this? Is it that when we are being asked to pay for these trainings, is there no real collaboration with these people to make them aware that we are also going into this? Because even in the university too, we learned some of all these things before coming out, and now we are still doing this thing again. So why is it that when we are being paid,
Okay, we understand. Yeah, we understand your question. Thank you.
I am David Hikweme, ACPN Lagos. Mine is my question is to the PCN registrar and also the leadership of PSN. This issue of patent medicine vendor's license, the big case for it all along was that we did not have sufficient pharmacists. But now, with the number of pharmacy schools, the number of graduates we produce every year, I'm asking, is there still a strong moral and legal reason to continue issuing of patent medicine licenses? Especially that new ones are being issued every year. Can we begin to interrogate this whole, even that research? I question that research. Because that research that we all quote, even as pharmacists, was sponsored by Melinda Gates, because they had a vested interest in making sure, in presenting a picture of lack of pharmacists everywhere, and so they wanted to bring in these other value chain players into the fold. Can we begin to interrogate that? And please, is there still a strong case for it?
The next question. I think he's gotten it.
Okay, thank you.
All protocols you observed. I am Unakpoya Aro, ACPN Delta State. The first one I have here is online presence and physical presence. I believe it's the same address. So I would like to give an appeal for the organizers of the program to consider the superintendent pharmacies for an online, and if I said online presence and physical presence, it's the same premise, the same address. So it's an appeal.
That question has been asked by others. So can you ask the...
Yes, the second one I have here is that for online pharmacy and telepharmacy, I would like the scope to be explained to us better. Because yesterday we were told that we should start small, using our physical handy devices like phones, laptops. So I like the scope to be explained to us. Then two, for telepharmacy, when we are starting small, at what point does registration need comes in? At what point will we need to register? Then digitalization is mechanization. For a registered...
Let me, please. When you speak, at all times and in any fora, make sure you speak well. The way you are talking, you can't practice in the US because those people talk. So they are not quite getting what you're saying. So let it be, speak to the microphone so that we can hear very well. They are saying they can't hear you well. They don't understand.
Okay, sir. Okay, sir. For online pharmacies, I believe there are different scales, different levels of the online pharmacy. We are taught that we should start with our phones, our mobile devices, laptops. So when we are starting small, at what point in time is the need of registration going to apply to the practice of the telepharmacy or online pharmacy? That's the first one. Then digitalization is mechanization. And we are taught that when we bring in machine, it will replace manpower. So for the 200-meter radius registration requirement, it is taken over by online presence. For young pharmacists that are coming up, what faith do we leave them to practice? Then...
Thank you. Thank you. Okay, I think we can start with the representative of DG NAFDAC and then come to the PCN and then our national chairman.
Thank you. Please permit me to stand on the existing protocol as I address these few questions that have been raised here and also make a reference.
Everyone has to consent you. Let me just read this. Sir, what is PSN? Okay, this is PSN. PSN doing concerning those non-pharmacists that practicing online retailing of, okay, probably it means PCN. What are they doing? Those who are not registered, I don't know whether you have registered anybody. The other one is reduction in the size of shops based on the type of shops for wholesale retail. Well, talking about the size of shops, relative to retail or wholesale, I think it's still PCN. Can any community pharmacist take up a lecturer job in a university? 3, explain the concept of satellite pharmacy and its startup. 4, can a medical sales representative of a pharmaceutical company own and register a pharmacy premises? I think that is the 4th question. It's all about you, Sosa. You can go on with your answer.
So thank you. I want to refer to one of the questions that were asked this morning, and somebody is asking, does NAFDAC have full support of other stakeholders, PCN, ACPN, and others? Did we enjoy that during our last operation? Well, I want to say that the operation was carried out from February down till about April and part of May. It was a collaborative operation that involved the National Security Advisor's Office, and NAFDAC and PCN as the regulators of this area, that's pharmaceutical product distribution. And also beyond that, the security agencies were involved, DSS, the military, and the police. The DSS did the intelligence aspect of it. I want to tell you that it was DSS basically that provided intelligence of the work we did. So that's a collaborative work. The police were there and the military were there to provide security while we operated. That's a collaborative work. In all the locations we worked, all the states, the state PCN officers were part of it. That's a collaborative work. And also the registrar was fully involved That's a collaborative work. Well, the question you may be asking, when people began to, mock NAFDAC and, throw a lot of things on us and all that, what was the reaction of these stakeholders? Well, we have been together with PCN all along, so there is no problem there. There's no problem between NAFDAC and PCN for whatever reason. But what I want you to understand was also that people were trying to create unnecessary friction. They made a publication and said that NAFDAC was blaming PCN, that PCN were the cause of multiplication of fake drugs everywhere. NAFDAC never made such a statement. DG NAFDAC responded to it immediately, and the PCN registrar also responded to it. But they did it intentionally because they wanted to create a problem. And also, people, whether we are taking over PCN job to start registering, people operating in the open drug market, there is nothing like that. That's not NAFDAC's job. But what some people must have interpreted as NAFDAC trying to register those operating there is that while we worked here, we knew the difficulties we had with data and information of the people who are operating there. And NAFDAC felt it was necessary for us to have a database that captures all those people. And some people said NAFDAC is trying to register those people. There is nothing like that. So, as much as I know, we enjoyed, a good cooperation of all those stakeholders. I think on another thing is whether PSN as a people and HCPN as a people demonstrated support. I think I saw some publications, they saying, oh, we support what NAFDAC have done and all that. But the only way I will want to say something again is that when we see something like that going on, trying to deal with a problem within our sector, there should be a massive, media support to counter what the other people are doing. So that's the answer to that question. Then, this other person is asking about service and orphan drug concept. Well, if any person comes into your pharmacy, the key thing you need to ask is identification. The person has to identify him or herself with his NAFDAC ID card. And if you are in doubt of that NAFDAC ID card, if you are a member of SCPN, every SCPN chairman must necessarily have the contact of the NAFDAC state coordinator and can quickly check up to confirm that. You must understand that NAFDAC does not only employ pharmacists. It's not possible. We don't even have that's possible to happen. We employ some other scientists. They are not pharmacists, but they are scientists. We have biochemists, we have microbiologists, we have other areas, then we have other people who are not even, they are basically scientists. So, and that qualifies them. They are trained on what they are supposed to do as NAFDAC job. And if somebody comes in and seems not to understand, it becomes a peculiar thing in that case. And if you are having issues, please contact the NAFDAC state office. Then about orphan drug and service drug, the program is still going on. It's something we can still take advantage of. But I appreciate what our elder from Ahmed said yesterday about this program. So I'm saying that program can be revisited again. PCN can make a stronger presentation to NAFDAC on that, and it can be explored beyond what NAFDAC is having, that if you need orphan drug and all that. Orphan drugs, what are they? Orphan drugs are drugs that are used to treat rare diseases, rare cases that are not lucrative financially or economically okay for you to ask people to register for it. Because if they register it, there is no way they can, there is no business sense in it. So such drugs can be applied for directly by people who want to make use of it. I know what we are requesting is to make it a cooperative something. But I know that NAFDAC also has a reason why they are saying, why we are saying that we don't want it that way. We want it to be in such a way that it will be accountable. But we can present our case with data, with information, and it will be on the dialogue table and can be looked into. Then somebody asks, foreign GMP inspection, why do you people go to inspect products that are registered by US FDA? Well, I want you to understand that it is a law in Nigeria. It's not NAFDA, it's a law that every product that comes into the national health system must be recognized by that health system in the sense that it is registered. And for a product to be registered, you have to have facts about that product to be able to register it. Beyond the documentary aspect of registration, we need to do facility inspection. And it will surprise you to understand that a facility is based in US does not mean that they don't have issues in their system. Well, by God's grace, I've been privileged to go to US for a GMP inspection. And that was my first time of traveling to US. And I was expecting, but I was so surprised that my lead inspector, who I think is one of our directors before, the late Mrs. Kerry, when she got into the factory, she was pointing out to them, this is wrong, correct this, why are you doing this, why are you doing this? And inside me, I say, even in US, yes, and not of that. I had a friend that went to Europe for an inspection, and when he went into that factory, the people belittled him. Say, why are you, not that they said it direct, but by the action and everything, they were asking him, who are you? You are coming from Nigeria. But by the time he finished his inspection, they were begging him, please, how do we do it? How do we do it? So it's necessary that that is done. Now, the problem we are having with the cost presently is not because, it's because of Naira exchange rate. It's because of the exchange rate that is jumping up and jumping up. Well, if PSN has, we can articulate something, it can still be put on discussion tab, but that's what the law says. Then let me quickly just make a reference to some questions yesterday that were not answered, and then I will hand over. NAFDAC sent non-pharmacists. I've already answered that. Non-pharmacists to inspect. And please, part of the things I wanted to mention is that when you see people coming into your premise, into your location, our manner of approach matters a lot. Somebody come into your premise and you ask and you discover that it's not a pharmacist, you say, no way, walk out of this place. You don't have the power to regulate me. You are not a pharmacist. You are causing problem for yourself. Because that person, if he looks at one or two things, there are a lot of things to pick up and say that there is a problem here, there is a problem here, and there is actually a problem. But once the person comes and is a NAFDAC staff, and when we say NAFDAC staff, I know PCN talked about the lacuna in the law yesterday by saying that the law didn't define that a driver can be a NAFDAC staff. No. But yeah, a driver is a NAFDAC staff, but a driver is not a regulatory officer. Regulatory officers are the people that are by the virtue of our job responsibilities, and a driver has nothing to do with that, but a regulatory officer who does that kind of job. So please, let's cooperate with them and let's don't create problem where there is no problem. Is it legally right to remove expired drug And where should we keep it? Should we keep it within the premise or outside the premise? No, what we are saying is that if you have an expired product, please, that product cannot be on your shelf. It cannot be on your shelf. Because you leave your products that are expired on the shelf and you are out, somebody else, your attendant or whosoever picks it and dispense, and somebody else buys it. Whatever is the problem, you are liable. So what we are saying is that go through your shelf. If there are expired products, move them out, put them somewhere, like in a carton or whatever, and write expired, maybe with your red ink, and keep it there, so that it will be there when you will hand over to NAFDAC or when ACPN will plan for destruction, and that will be done with NAFDAC. But don't leave it on the shelf. I think this had addressed the issues I have here, all the questions that is thrown to NAFDAC. Thank you very much.
Sorry, before you hand over, I wanted to make comment on the last statement, especially on the destruction of the expired products. And I know that we have made a lot of attempts, especially here in Anambra, for this conference to be one of the pre-conference activities we want to do. And we made the application to NAFDAC, and my members have worked towards that destruction. And I know for the past 10 years, from privileged information, the ACPN members here, I wonder how and where have they destroyed their expired products. And NAFDAC doesn't show concerns in that aspect. And we've been discussing this for the past few years on our members' regarding the demand from NAFDAC as regarding when you want to destroy this product, that they have to pay, that is in the law and all that. And I know we'll discuss it in different AGM, and we'll make arrangement and advocate visit on that regard, and nothing happened. And also, this year, we couldn't do this exercise because there was no response much, or rather the response came very late. We couldn't do anything. And there also that attachment that we are going to pay still come up there, which our members are kicking against. That is one. And also, you made mention on the orphan and service drugs. Our members show a lot of concern because our clients are using that. And I know there's a lot of embarrassment last year in some of our leaders that have practiced community pharmacy for more than 10 decades, or more than 3 decades. The likes of Alpha Pharmacy, NS Okof, and Net Pharmacy and all that NAFDAC visited on that issue of service drug, and they charged a huge amount of money. Those are my members that show concern. And I know we have done a lot of advocacy on this issue of service drug. Even ACPN tend to register. I know whether we can hold this, you can get few of our members, wholesalers that have capacity to get this product by themselves. We now know the source where we can go and access from our member, either program or ACPN as an entity. We have an office when we have applied to know whether we can go venture into this, so that we will be able to provide these services to our clients. And we have done a lot of advocacy visit on that. And I am appealing if you can also help us. Because we ask question, who approved the service drug and orphan drugs, even at the NAFDAC level? Who is handling it? It might be on the purview of the DG NAFDAC or whoever is staff or director or something like that. Who does that? Because I know the issue of service drug and orphan drugs is a very serious issue we must discuss. If we can come up with another delegate that you are suggesting. But my question is that if you can help and lead us in this aspect so that they can still produce fruit.
It's okay. Let me quickly address that. Concerning the issue of destruction.
Just before you find please, I'm also adding my appeal. Those of us who are on the 7th floor and above, we can't get the drugs that are prescribed for us. They are all service drugs, orphan drugs. I call Alpha Pharmacy every living day for one thing or the other. they don't even have it. So please, it is very important that NAFDAC comes to a consensus with us on how we can make available service drugs. They're the ones I need, even myself as a person. I just came out of surgery, and it took time before we went into that surgery because there were certain drugs the hospital was looking for that they couldn't get. So it's a very important thing. Let us not do human sacrifice.
It's okay.
When we can that drug, it's like we are doing human, we are killing particularly those who are higher up.
It's okay. Because of the regulatory system.
Before Past President Olumide.
Okay.
The chairman of the forum and distinguished panelists, fellows of the PSN, distinguished ladies and gentlemen. I had actually planned I was just going to sit down quietly and observe. But I just look at the trend of events, especially with NAFDAC. And Pharmacist Louis, I am constrained to say this. And if Madam DG were to be here, I would have said this directly to her. But please, you can quote me. That this is one of the feedbacks you got from here today. The real problem with NAFDAC, it's the style of your DG. The style of the DG NAFDAC is what creates all the complications in the relationship with the PSN and its affiliates. Many times, it is impossible to have positive or productive dialogue with the DG NAFDAC. I guess she probably thinks she is above this profession or the practitioners. So you do not relate with people at all. The relationship management is wretched. It's unprecedentedly wretched, bad. And that is why, once you do not give people an opportunity for open ventilation, what you get is that, it was on the pages of newspapers, for instance, people read that you want to you want to begin to register places in the open markets. Then you will not have any other choice, and people meet you at that same level by reading their responses too on the pages of the newspaper. And that's why I think we need to handle this relationship a lot better than what it is now. I do not want to begin to say certain things here, but past President Uwaga and some of the past presidents here will tell you there was a time there was a very serious challenge. Even past presidents of the PSN could not see the DG NAFDAC. We were part of several delegations to see presidents of the Federal Republic of Nigeria, but we couldn't see DG NAFDAC. And it puts people off. So you need to convey this because she needs to do something about it. And that takes me to the challenge of, what is it called, service and orphan drugs. Look, life comes in dispensations. We used to have I've forgotten what we used to call those centers. COPA centers. There was a time we used to have what we call COPA centers. We have worked with other leaderships in NAFDAC. And those COPA centers activated our requests for service in orphan drugs. I think what is happening is that Madam DG in particular is opposed to that concept. That's because you don't talk to anybody. That's my own perception. In the immediate past dispensation where we had Dr. Paul Lorry, I was president of the PSN. The directorate R&R at NAFDAC was so cooperative, worked with us. All you needed to do was to pay 2,000 per service of orphan drug. And they accredited you to bring whatever you wanted to bring in. We paid just 2,000 naira in 2015. If you check PSN landmarks, you have these things. It's the same challenge we have with the disposal of expired drugs. I don't know why they don't want to tell you the truth. You people said we should pay. A man has lost money when products expire. You are not telling him to come and pay to dispose those expired programs. How do you expect people to cooperate with you on such a policy? And every time they took it up with DG, she was very defiant. Sometimes it is not only one person who has a monopoly of madness. Yes, and I think you need to take that message back. Finally, let me also say this, because you say we should cooperate every time people come from NAFDAC. We live in interesting times in Nigeria. So there are many people, there are so many fake inspectors out there. So as regulators, I think it is clear, because it's PCN and NAFDAC who regulate us. The only people who should access a pharmacy from PCN are people who are now clearly designated as pharmaceutical inspection officers. So they should have ID cards. At NAFDAC, you have two major categories of regulatory officers. You can either be a drug or a food inspector within the confines of the food and drug laws. Am I right? So the only reason I'm saying that is, logically, if anybody will embark on surveillance or regulatory activities under NAFDAC, you should normally introduce yourself by saying, I am so from NAFDAC with your ID card. I'm sure nobody would doing your job. But you cannot just come in and say, I am from NAFDAC. People use it's an extortionist mix, and we have to be careful. So, basically, at the end of the day, this is about certifiably dysfunctional procedures. Once you cannot guarantee that they are certifiably functional procedures, there will be a problem. And the more we dialogue, the more we have ventilations like this, it will help. Let me put on record. The DG NAFDAC, since our appointment, has attended only one program with the Pharmaceutical Society of Nigeria. It is the worst record. Tell her. The only program of the PSN she has ever attended was the last inauguration ceremony of the incumbent president. Since she was appointed, even in the year 2021, she was made a keynote address speaker in Port Harcourt. She addressed us on Zoom. If I were president, I would have rejected it. I would not have allowed that address. Because that same year, she was in the US at NAPSA to deliver a keynote address. It is not right. The way we treat ourselves as pharmacists sometimes is baffling, if not outrightly incomprehensible in terms of how we bring ourselves low. DG has also attended 2 programs at Acpn. I remember she was at, perhaps Walola Digbolu is a very special man, because I remember she attended his inauguration in Lagos, and then he was also at his last conference in Ibadan. So that's not the same thing. It's almost, we count it as a right that the Register of Council must be part of our program. So what is the essence of having, if you see what, I negotiate on behalf of pharmacy at federal government level. If you see the type of things people in the physician tribe do for their members, you weep for our profession. Where you see what our DG, the way she relates with us. And I think you need to take this message home. Thank you very much.
It's okay. Yeah, thank you very much. Your ventilation is very much welcome. And I want us to understand that the essence of having this meeting, town hall meeting, is for cross-fertilization of ideas. So he's quite okay saying all that he said. And I want to say that such discussions, the approach should always be constructive. And when it is constructive, you put the other person on a very difficult position not to react or respond aright. And when the person doesn't respond, history now takes it down. Now, let me quickly address some of the other things that have been raised. Definitely, I'm going to communicate to the DG NAFDAC the concerns that have been raised here. I will communicate that to her, because that's why I am sent to come here. Then the other thing again is to speak on the fact that for regulators who go out for inspection. Now, when you look at the regulatory officers that NAFDAC we are having a population of regulatory officers of just about 2,000 or less than 2,000 serving an entire nation. And let me give you a typical example. We come to Anambra State where I am the state coordinator. How many regulatory officers do we have? How many pharmacists are working here? I am a pharmacist. Then I have one of my officers who is sitting there who is also a pharmacist. And those are the two pharmacists we'll have in Anambra State. Now, the fact that we don't have those pharmacists working with us is not the problem of NAFDAC. NAFDAC had made requests several times, but federal government has its own reasons and all that why those employments are not being taken. I think PSN, the person here sitting with me, was once in NAFDAC, and he understands the trouble there to employ staff. So, and when the condition is like that, you can't say now that it is only one pharmacist you have because me, I'm busy with administrative work and all that, that I'll be doing inspection, the whole inspection. And that's why when training are done, we do our training in such a manner that even non-pharmacists are trained to do pharmaceutical inspections. Non-pharmacists. And they are experts there. You know, they are experts there. So we have people who have read food science, we have people who have done this and done that, but they are pharmaceutical inspectors because they have been so trained. Today in our system, we have training for pharmaceutical inspectors, we have training for, you know, every other person will have general trainings that go on. But because of the issue of constraints of staff, there are things we would have loved to have it the way we say it here, but the system is not allowing it. That's number one. Then when an inspector comes into your premise, please, what you are going to ask is, who are you? Where are you coming from? That's what we expect, and that's what our inspectors are told to do. No NAFDAC inspector will barge into your place without identification. And if that NAFDAC inspector fails to identify himself, you, as the owner of the premise, has every right to request for his or her identification. And if the person says, I am not going to identify myself, you have the right to reject the person entrance into the place. Are you hearing what I'm saying? You better hear now. You're listening. Because, and the means of identification is NAFDAC ID card. And I said it in my first, when I responded initially, that if for any reason there is any reasonable cause for you to doubt that identity, you can always reach out to the state coordinator through the SCPN chairman of that place. That is it. So that makes it easy. That shouldn't be a problem. Now, when it comes to the issue of orphan drug and service drug, well, I understand the difficulties we are having. And I would say, if I tell you here that I myself, who is not, I'm not into buying and selling and all that, but I have been procuring medicines for my beloved ones. And some of these are service drugs. But I know a pharmacist here in Nigeria who has that license to bring in service drugs and all that. Each time I need those drugs, I just send the evidence of what I want to bring and the prescription that was made and all that. And I'm telling you, this same pharmacist living here in Nigeria, somewhere in the southwest, within 2 weeks, or at most, he provides me those medicines, legally coming into the system. And I give it to my beloved ones. I've not used it to do business anyway. I get it for my people who need those drugs. So I am saying that these things are still practicable, but I understand we may be having challenge. And please, you can take down this email address. For any service drug or orphan drug application, this email address should be used. And please, when you are applying for that, once you send in that application, whichever state you are sending that application from, please try and contact the state coordinator and let the state coordinator know that you sent in this application and let him follow up on that. And that email address is registration@nafdac.gov.ng. registration@nafdac.gov.ng. So when you do that application, you send it in, and please provide your information, your license, your identification, and all that. Then let the state coordinator of the state know that this application is filed in, and it will be followed up immediately. Then, as per the issue of destruction, well, there is a provision in the NAFDAC tariff that for destruction to take place, payment has to be made. And to be fair enough to NAFDAC, I want to tell you that every activity that NAFDAC carries out presently is funded by NAFDAC. There is no subvention, no money the federal government is giving NAFDAC to do those things. And when we do destruction are planned. Like the reason why the application you made couldn't go through was that when that application came, we were in the heat of this Onitsha something, and I threw it up to the director that was there. But unfortunately, the director couldn't attend to that because he was doing a lot of things at that time. But immediately we had a new director coming in. I put it across to him. Within 1 week, he responded, and I sent it to you people for implementation. But I know that the major challenge we'll have there is about the issue of payments. Well, the only thing I can still say we do is through the PSN president. The PSN president can make a submission to the if you make a submission to DG NAFDAC, and DG NAFDAC is not obliging, you have the liberty to make a submission to the Minister of Health. And you present your reason and your decision. And the Minister of Health now can, move in that aspect. So I think that's all I can say about that. Thank you.
Thank you very much. The PCN director representing the registrar will now speak. But I want to say something. I know that NAFDAC funds all these activities. I want to say something to say that the cost of any medication in Nigeria adds up all the monies we pay to PCN, to NAFDAC, to regulatory bodies and all that. That is why medicines are costlier in Nigeria than in many other countries. I did that comparative studies in my project when I was in NIPS. So we need to note some of these things, but he has said something that is right. I think we need to tackle these things. If the DG NAFDAC cannot, we take it up with the government. Thank you very much. Over to you.
The chairman of this session, members of the panel, distinguished ladies and gentlemen, to save time, I have 26 questions here, and I know time is of the essence at this meeting. First and foremost, I want to crave an indulgence to permit me to be as brief as possible, and please pardon my brevity. And riding on that, I'll take them one after the other. And again, you may wish to pardon the speed at which I'm going to speak, though not at net breaking. What constitutes clinical practice in a community pharmacy, especially with regards to the disposition of the enforcement team of PCN at the last enforcement exercise at Akwa Ibom and Cross River State. This question was asked yesterday, and I made effort to address it by being a bit legalistic. And I'm going to toe the same path, although with a difference. I said yesterday, and I'm repeating that, our licenses, be it premises or pharmacist license, spelled out what the license covers. I want to believe that nobody could have adhered to the provision of that license, and the enforcement team would maltreat the person in the word, or embarrass the person in the word of the person who asked the question. I'm going to be compelled, if not impelled, to say that listing clinical activities by me will not do justice to setting a limit or a boundary to what clinical practice is within community pharmacy. But I want to say that it would not be nice that a pharmacist be setting lines within community pharmacy. In the word of one of those who asked the question, that they've been trained on parenteral administration of drugs. I don't think, even if one is trained, I recall I was trained to inject while I was in 300 level in the Faculty of Pharmacy. Upon graduation and having the knowledge of the law, I never injected anybody other than myself when I was serving in a rural area and I had a health challenge that warranted me to inject myself. And whether that was legal or illegal, I was able to save myself. I never injected anybody upon graduation, in spite of the fact that I was trained to inject while I was in 300 level back to my undergraduate days. So the fact that one has been trained on parenteral administration of drugs does not give one the legal backing to administer drugs or medicine parenterally. If that was what was being undertaken while the enforcement team came around in those two states, I want to believe that such practitioners will have them to contend with. Place of State Ministry of Health in regulation of community pharmacies. We all know that drugs and poisons are item number 21 of Schedule 2 of the exclusive. But the way we operate from the end of Pharmacy Council, because of death in the number of staff, is that we have PIC that have been working in collaboration with PCN. PIC is Pharmaceutical Inspection Committee, instituted in various states. And the chairman of this PIC are directors of pharmaceutical services of respective states. If that was what was misconstrued as state regulating community pharmacy, I think there might be need for us at different fora other than this to understand what PIC stands for and the scope of activities of PIC. Review of position of superintendent pharmacy for online pharmacy. This morning, while the representative of ePharma for FP was presenting, she made mention of the fact that the regulation on online pharmacy or e-pharmacy as it were is still available online for us to make input as to the way we want it to run in Nigeria. So I will advise us, whatever is our desires, aspirations, and yearnings concerning online and e-pharmacy, we should please make input into that regulation so that the way we all want to go, after all, is a profession, and one of the hallmarks of the profession is self-regulation. So the way or a manner that we want to self-regulate ourselves will only be complete if you and I will make necessary input in line with our yearnings and aspirations for online pharmacy. PCN to liaise with FMOH on how online pharmacy and some other regulations should be conducted. That is noted. I think that is a piece of concern. Weak regulation of wholesale pharmacists or wholesale practitioners within the pharmaceutical space. That one was also like an observation and is riding on what we had yesterday, and the recommendations as read out yesterday are being expected by the Registrar of the Pharmacy Council of Nigeria, because I briefed him yesterday giving report of what happened or transpired here yesterday. That also is noted for better regulation. This one seeks further clarification on online pharmacy vis-a-vis affiliation of online pharmacy with the brick and mortar pharmacy. That is also similar to what I earlier mentioned. If we are of the view that online pharmacy should not be an affiliate of the brick and mortar, however we want it, we should make our input. But let me put this on record, that it is not only pharmacists that are applying to undertake or run online pharmacy. I don't want to believe that everybody in this hall is a pharmacist. And as such, there are some things I may not be able to say here. Those who had the benefit of attending the workshops where issues around online pharmacy were discussed are privileged to know that there are so many things we cannot say here. Pharmacy is a profession, and whether we like it or not, regardless that some persons may be here who are not pharmacists, we should be seen to be protecting our profession. I think with that, we may have to seek better or maybe other fora to ventilate on why some sections of the regulations are reading what they read today. Committee for Inspection of Hospital Pharmacy, whether there is one, yes, the Governing Council has approved the need to have a standing committee like PIC for the inspection and accreditation of hospital pharmacy in the states across the country. But this committee is yet to be inaugurated on the part of the registry. We are waiting for the inauguration of the Governing Council in order to fast-track the inauguration of the committee before the committee will start work. Enforcement, embarrassment of pharmacies at enforcement exercises in various states. I think I've tangentially addressed that, and there is a point to note that I'm going to take a message of the need for the enforcement team to tone down the approach to the registrar, and I believe at any other exercise or any of such activity that may come up in the future, that will have been addressed. Clear guidelines for enforcement. Yes, there are guidelines for enforcement and they are clear and it's available at the PCN. I wouldn't know the yearning of the person who asked the question, whether it's requested that the guideline be sent to individuals, but then I know there are clear guidelines concerning enforcement with PCN. Another question was on relativity in the size or sizes of premises, be it community or wholesale. I would say one of the recommendations yesterday from the talk given here will address that. And as such, I wouldn't want to waste our time on that. Satellite pharmacy concept, explanation was sought on this. I don't think this, the amount of time that we have to close this session will allow me to offer explanation. What I can say about the satellite concept is to promote access and availability of pharmaceutical services to the grassroots and the hard-to-reach area, such that pharmacies could have affiliates of their operations in other areas with lesser regulatory requirements. That is what I can say in a nutshell about the concept. There was a question around internship center, which wasn't too clear to me, and as such, I'm going to skip that. Can community pharmacists take up lecturing job in the faculties of pharmacy without wasting much time? The answer is yes. But the condition for doing that must be fulfilled. Where are the conditions? I think the person may approach the faculties of pharmacy for that to save time. Criteria for reopening premises in view of the fact that premises that were seized during enforcement exercises were seen or cited opened in less than 48 hours. That could be due to breaking of seal, which is also an offense, and PCN has a way of addressing that. It could also be due to fulfillment of the compliance directives given to them. If the compliance directives have been met or addressed, then such premises could have been opened by PCN itself. Proliferation of PPMVs. What is PCN doing? Proliferation of PPMV, patent and proprietary medicine vendor shops. What is PCN doing? Exactly what PCN is doing. The patent and proprietary medicine vendor shops are not opened with a prior knowledge of PCN. Any and everybody that has money and interest in opening shop gets a shop, opens it, and then thereafter invite PCN. That is for those who are even ready to submit themselves to regulations. Otherwise, the practice is they get the money, they open the shop, and they are operating. What can PCN do to that? Other than to come back, to appeal to them, to be regulated. We've been trained in recent time to be friendly, to be persuasive, to be supportive in the way and manner regulatory activities are carried out. What we can do is to come after they have opened. And before they open, is to embark on massive sensitization, public education, and enlightenment. Those are the things we can do. And the bit we can do in that direction is what we can do, and is what we are doing. Considering the intensive capital, or the capital that is involved in carrying out advocacy, public enlightenment, and education in Nigeria. Point of care training and practice. I think I've addressed that. And let me say this. The fact that Medical and Lab Science Council comes around may continue to be seen. How do I mean? We were at National Council on Health, where the PCN was an observer and still an observer, like the Medical Lab Science Council. And the patent and proprietary medicine vendors, as well as community pharmacists or pharmacies, were given the approval to undertake malaria rapid diagnostic testing, which is a point of care testing within their premises and shops. In spite of that approval by the National Council on Health, that is the highest decision-making body on healthcare, Medical Lab Science Council still challenged the position, in spite of the fact that it was part and parcel of that meeting. So if that happened, they will continue to come around when it comes to anything that impinge on what they perceive to have impinged on their own regulatory activity or their statutory role as healthcare workers. What can we do to stop patent medicine vendors' license? That in spite of the fact that we have increase in the faculties of pharmacy, number of candidates graduating as pharmacists, and so on and so forth, we are still licensing patent medicine vendors. The truth remains that in spite of what we have said, the number of pharmacists in Nigeria is not enough or sufficient to cover everywhere. Patent medicine vendors will still be needed where there is inequitable distribution of healthcare service. But the issue is that where they are not wanted or expected to be, they are still there. The question will have been, what is PCN doing? PCN is doing what it can do through the enforcement that some persons who have come out today are advocating for example, from Bayelsa State, please come around and save our soul. Let the enforcement be regular, more regular. Whereas from another state or two other states, it's like whenever they come around, please tell them to tone down the approach and approach we pharmacists with some level of dignity. How do we strike a balance? That would be a take-home message for me to PCN. We're going to do that. Digitization and online pharmacy. How can we start small? At what point of development of taking advantage of digital pharmacy practice that will be regulated as online pharmacy? At the point that it coincides with the provisions and requirements for online pharmacy. If what we're doing today is just at the level of WhatsApp, that may not be taken as online, depending on our definition. But at the same time, I believe that the current regulation is looking that direction to say that it is part of online pharmacy practice. So, for us, the online pharmacy regulation has not been concluded. It's still a work in progress. We all are at liberty to make input and contribute to the work that is ongoing. And I would advise us not to lay back and be saying, what is PCN doing? I've been hearing what is PCN doing since I graduated from the School of Pharmacy. It is what we all are doing. We all have to make input into whatever we are developing in the name of the regulation. With this, I want to say a very big thank you for the audience and for listening. Thank you. Thank you, sir.
Thank you very much. I just wanted to add to that's a question you escaped, and I just want to make a suggestion on that regard. And that is when council or PIC seal a place, a premises, and within like 1 week, maybe they pay penalty and it will be on sale. And the status quo still remain. So I'm thinking, I saw what the council did recently, maybe in Cross River, where they use courts, a competent court to seal a premises there. And I believe that there was a time we wrote a letter to council on that regard, and one whereby if council can provide a statute of a particular premises, maybe we feel that it's irregular premises, held under different states, and we'll collaborate with ACPN and use court to seal that place, it is only court that can unseal it. If council can provide us some information in a particular premises, we feel that it's irregular, we'll write to the council and ask them to show us or to send all the status of this place. I know we wrote a letter like that from Labour State, and the information was not provided, and the status still remain. But we want to collaborate with the council in this regard, so that we can begin to use courts to seal some of those premises if they are actually, operating irregularly. And that is what the mandate we want to also pursue now. And on my own question, somebody asked about bag, and I know we have a good number of bags here, and we work based on people that are accredited for this conference. And we don't have plan for people that didn't attend conference, and we begin to pack conference material or bag back home to people that have not attended. I don't think we will have that capacity to do that. And also, we make our appeals. It is our appeal we make on daily basis to the companies to assist us in getting this bag. And those bags are very, very expensive. On the another question somebody asked concerning the discipline based on NEC presentation, that they get NEC are also mandated states to submit their bylaws so that our committee on constitutional review and litigation will be able to assess and harmonize those bylaws so that it will be in consonant with the Acpn constitution vis-a-vis the PSN constitution, so that it will reduce all these conflicts from different states. Thank you very much on this.
Thank you very much, my fellow panelists. But let me make an observation and address it also. The national chairman took so much time to make a presentation on the matter in Abuja. And I was expecting people to send in their questions and all that, but we all seem to have understood what he was trying to say. And I want to believe that we understand and we agree with the national chairman and the national executive committee, the council rather, that steps taken so far are proper, they are right and proper. So I want somebody to say that steps taken so far are right and proper. That means that the only thing remaining for us is that by tomorrow, a motion will be moved at AGM and it will be cemented. Because nobody spoke anything to the contrary. So can somebody rise and say that steps taken so far on behalf of this town hall meeting, steps taken so far are right and proper? I want to hear that. Okay. Okay, is there a microphone?
Thank you, Mr. Chairman. Thank you, sir. The national chairman, from the discussions we've had about the Abuja matter, I, Pharmacist Nengi Lawson, concur and agree that the steps taken so far are right and in order in the interest of the association. Thank you.
Is anybody supporting him? Say hi. Thank you very much. So what remains is that tomorrow, by AGM, we'll put a stamp to this. Okay, we listen to our regulatory officers here. I only want to add a little thing, my director. There is something called ticketing, because when I was in Law and Ethics Committee of Council, it was my own committee. Even the 200-meter thing, it was my own committee. It was my own brainchild leading that committee. There is something called ticketing. If the infringement is minor, I would suggest that you talk about it when you go back. You ticket. Within 24 hours, see the team, the enforcement team, or 48 hours maximum. But it will not be proper, even for minor infringements, to shut down the place. It doesn't give us, that was what I was trying to say. So please, let it be part of what you take back, you know. Louis, you still want to say something? But you know you're a trainer, so you can talk from now till tomorrow. Just 1 minute, because I want to shut down this.
Okay, just a minute. The request I wanted to make, please, just, sir, we do the ticketing stuff for NAFDAC. For every premise we visit, if there are infringements, you are invited. But we also need to plead with our people, sir. There are people you invite, they will never come. That's actually what pushed us to start sealing. But what request I want to make to this August Assembly is NAFDAC is going through some real, navigating the political landscape and all that. And I know that in this, we have people who, in terms of the politicking and all that, one of the supports we can give is from that perspective. And you discover, sir, I don't have all, it's not something we'll be saying, like, there are some things that can be done and it will be easy for NAFDAC to operate the way we want it to be. For destruction, the last destruction we did here, we paid, to get a space here, we paid over 10 million to give us a space to do destruction here by the government. So those are part of the reasons why some of these things happen.
Thank you. Past President Okwo was raising his hand. Okay.
Chairman, I don't want NAFDAC to get away from here with the impression. I just do the small exercise. I was asking Alexa a simple question. Who pays for the destruction of expired drugs? I mentioned 3 countries, UK, US, Pakistan. And let me read what returned. In the UK, the National Health Service funds the safe disposal of unwanted and expired medicines. Even those returned to pharmacies. Pharmacies are only obligated to accept this medication from the public, and the National Health Service covers the cost of their disposal through specialized waste contractors. So it's important that we're not going to create the wheel again. We cannot pay for the destruction of expired medicine. You charge a lot from manufacturers, importers. Please put a small fee when you are licensing products for destruction. Double jeopardy for pharmacies who have had expired products costing so much, and you're going to ask us to pay again for destruction. We are not going to take that. And I'm asking, Chairman of Acpn, would the PSM president, let's do a memo citing many of these examples. We are not creating a wheel. Hello, Chairman, liaise with the PSM president. Do a memo to NAFDAC once again on disposal of unwanted product, expired product. If we don't dispose properly, in fact, the bulk of expired products are with patients at home. We are not encouraging them to bring them to the pharmacies for destruction. And what do? We are polluting the water table, the aquifers in Nigeria. So this is a message you must also take home. Thank you.
Thank you very much. Chairman of BOT. This one, just because the next program is being lined up. So
thank you.
Respectfully.
A very short one. Ambrose, my national chair, on your comment about bylaws. Can we create a generic bylaw that will serve every state? You only adopt it, put your names and information, so you don't have to go and start reading through them. You have a bylaw already drafted by national, vetted by NEC, in which your chairman and secretaries and members of NEC of Acpn. You now give them that copy. They go back and put their names. So don't read through it 2 times. Just one document. Thank you.
Thank you. Rotary President, Pharmacist Rotary President. Oh yeah. You have 1 minute. You cannot have 2 minutes like Chairman of BOT.
All right, sir. I actually came out to defend the council on the enforcement. I heard the emotional outpour of our colleagues from Akwa Ibom. Incidentally, I was part of that team that was in Uyo. And I think as pharmacists, it's high time we begin to do things very right. 2 cases, sir. A premises was got to in Uyo. We met a retired professor. And right down at the corner room, on the mat, they placed a patient. and they were administering infusion. Who does that? When the professor was, was put on the spot, he was so ashamed of himself. He had to take his car key and ran away from there. Meanwhile, the same professor, we saw his license in another premises. That's not fair. Another premises was gotten to. We met a pharmacist administering again infusion on a patient that sat down, an elderly woman. And the family were just seated at the reception looking. Opposite this place, there was a specialist hospital. We are fighting the medics about us being recognized as consultants. If you must do it, let us do it right. On and on, I can give instances. And the good thing with the council now is that when they go out for that operation, they have specialized camera that captured these events, that recorded these things, both on video and then also on the whatever. A woman came to lie in the office that they took away and handcuffed a sales girl. The husband said he works in the presidency. He flew down to Uyo, was going to scatter the whole place and cause trouble. Lo and behold, by the time the team returned, because I was on that team, we came back and showed them evidences. They became apologetic. Meanwhile, they have already posted this story, manipulated one, on their platform, and they are sharing it. So please, Acpn chairman, you have work in your hand and your neck. We must talk. We were the one complaining. PCN is not working. Where is PCN? Now they have woken up. Let us support them and see that they succeed. And we have a cleaner environment to practice. Thank you.
Thank you very much. The last speaker said it all. What some of our colleagues are doing behind the scene is horrible. Let us not pretend to support anybody to do the wrong thing. But we have heard it all. One of the things that we are taking home is that there's still a lot of work to be done and a lot of collaborative work to be done with the regulatory agencies. One of the committees that we set up that has done marvelously well was the Fakulujo committee yesterday. So I believe also that such other committees can be set up to look into some of these areas. And I also want to believe that we can set up intelligence units in our states of practice. There are people who are doing the wrong thing. A pharmacist has no business with giving injection, giving infusion, and so on and so forth. You have no business with that. You can still achieve that with your tablets and with your capsules. So we need also to set up intelligence units where such things happen. We can, I think those intelligence units should be able to inform you people so that it will be, pointedly you can reach such places and discipline them. But nonetheless, I want to tell the regulatory agencies that they have to put a human face to their enforcement because the country is in disarray. Too many things are wrong and very, very wrong, and they affect us professionals more than any other group. So you have to put a human face. If you don't, it means that you have to carry all of us and lock us up or shut down, because any pharmacy you shut down, that particular community is lacking the service of a pharmacist, which comes first before hospitals. Having said that, I just want to thank all of us for having been so patient to listen to everything we have just done ourselves a favor against tomorrow. When the national chairman will conduct the AGM, things will go on very smoothly. Once again, I want to thank the panelists and Mr. Chairman, who gave us the opportunity to address these issues, in this, And I also want to thank each and every one of us. We shall continue to move from strength to strength. The Acpn we knew in those days, and the Acpn now, it's like in those days we were living in the cave. But today, you can see how our practice, we shall continue to move from strength to strength. Once again, I thank all of us, and I will ask that God will bless us individually, corporately, bless the ACPN, bless our regulatory bodies, bless the PSN, bless Nigeria. Continue to serve this country. Thank you very much.
Pregnancy.
Thank you very much. Thank you very much to our elders. This was a very meaningful discussion. I also want to thank all the delegates for staying put while these very critical discussions go on. After now, we're going to be having our Silken Africana night. The red carpet starts by 5 p.m. All right, so there's ongoing right now is AGM for cooperative, for ACPN cooperative. The AGM is ongoing. The AGM is ongoing currently. I think we can move to the right-hand side of the hall for the AGM. The ACPN National Cooperative AGM is ongoing currently. The Silken Africana Night Red Carpet starts by 5 p.m. So please prepare yourselves, make yourselves available to attend these programs. Thank you very much. So can we have the ACPN AGM? ACPN AGM on the right side of the hall, please. Thank you. One of the delegates is looking for her glasses, her reading glasses in a glasses case. Please, if you picked it up yesterday, could you please bring it forward to the protocol stand? Missing glasses. Thank you.
Hello, please. If you are a member of ACPN National Cooperative, please move to the right side of the hall. That's my own right side. If you are facing me, it's your left side. Please, let's quickly have it. Within, under an hour or so, we should be able to round up. If we start now. Please, let's gather on my right side of the hall as I'm facing you, or your left side if you are facing me. Thank you. This mic, will it not be too loud? Do we need it? We don't need the mic. Okay. So just. I don't know. Go and start something. You won't have the time. Have your mic? I don't get it.
very much. So now please we take opening remarks from the MP, the host of this event, Pharmacist Tuchewanda FPSN. Immediately after his opening remark, he will open the dance floor. Thank you.
I appreciate our hand of applause, please. I appreciate our please, not easy. It is not easy, please appreciate that. Keep appreciating, keep appreciating that. It's not easy. Thank you. Thank you. Thank you. Please appreciate my leaders. It's not for opening my please. Appreciate my boss himself.
National chairman, this is the chairman of past chairman, fellows of society, my fellow colleagues. I want to start resisting protocol. It's a very big pleasure to welcome all of you to the 6th lectures with Afrikana night. We cannot thank the pharmacists enough for all the support you have already shown us. Without the pharmacists, we wouldn't be here. Tonight is not for so much speech, but to really appreciate all the efforts that people are making in supporting us, and we also trying to make sure that every single lecture product that we sell, you are sure of the quality, and your patients are going to get the right result. So tonight, we really thank each and every one of you that is here, and we implore you to really enjoy today. We have a lot which is out there for everyone. Tonight, a pharmacist is going to go with the 6th car, 2015 Nissan Road. One of our colleagues is going to have this car tonight, and so many other gifts here. I want to implore you to enjoy tonight and make the best of whatever that it is. We need to relax. Why we always do this is that we work so hard. We spend a lot of time sourcing, purchasing, inventory. But tonight, we want everybody to be free, dance, enjoy yourself. Thank you once again, and God bless you all.
Hand of applause, my boss. Hand of applause. Keep appreciating him. Keep appreciating it. It's not easy. This is Afrikana night. Hand of applause. Keep appreciating. All right. Yes. 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 DJ, finally. Ladies and gentlemen, tonight is Afrikana night. Please hand of applause for yourself, please. Hand of applause for yourself. On my list here, I have many things I want to unveil to you people tonight. Maybe most of you didn't know I'm also a pharmacist, and not by native one. There are difference between pharmacy in the hospital and the pharmacy in the village. The difference is that we do our own herbal one, people do our own pump. So our own is herbal and your own is pump. So right now, my own herbal, I'm giving you people now is original one, pump one. So I have nation skill. I don't know, most of you might have seen this, our product here. Many of you have seen it, many of you have not seen it. I don't know if the product is here, please bring the product for me, let me see. If the product is here, please bring the product, let's show people something, please. Where are my ushers, please? Where are my ushers, please? Men's zone. Which one is men's zone? Please, help me the men's zone. I want to show my people something. I want to do some marketing and adverts. I want to show some people things, please. Give me men's zone. Let us see something. Please, I want them to show them one or two from what you have in store. We have many. Okay, it's not here. It's not official. Okay. Okay, I have another one. I have Desire. I don't know whether he's here. Is he here? Adam Desire, is he here, please? They are all here. Okay. Additionally, we'll finally.
Sorry, please, I want to profoundly apologize. We start from where I started. Added to that, I had it. So I'm struggling with my sight.
Oh.
I'd like to do I want to specially recognize the past president of the Pharmaceutical Society of Nigeria, the fellow of FIP, the fellow of PSN, the living ancestor, Acpn 44Th. Please, can we appreciate him? And then I recognize the Chairman Board of Fellows, Pharmacist Afrikana FPSN. I want to specially recognize
Pharmacist Gosa, who you recognize. Round of applause for them, please.
Now invite the National Chairman of Acpn for a brief remark. After your remark, Chairman, yourself and the MP will please dance. Please, can we appreciate our National Chairman?
Praise our National Chairman. Appreciate Pharmacist Gosa, please. Thank you. Keep clapping, please. Keep clapping for him. He's my boss. Keep clapping. Keep clapping for him. He's my direct boss himself. Keep clapping while our national chairman is coming. Keep appreciating him. It's not easy. All like my brother, all do good and do try. Thank you. Hello. Good evening, colleagues. Let me also stand on the existing protocol. Then before then, I need to also recognize my brother and elder, past president, Asumi Koko, FPSN, FFRP. Welcome, and all distinguished fellows, distinguished community pharmacists and president, medical award winner. Thank you, colleagues. I just want to thank Dr. Phil. This is the 6th edition of Dr. Phil Afrikana, and he has become a man in the ACCN conference, AMA. And I know that a lot of companies are beginning to tell us anything or what he's doing. And he spent a lot of money to ACCN in making our conference very, very fantastic and fantabulous, making it very, very enticing, and people would like, even if they don't go for gala night or they must attend Afrikana night, secret Afrikana night. So we appreciate you, we thank you. We have told us the food, and I continue to encourage our members to keep on buying the products, keep on recommending and let us be products. It's good, it's working. I appreciate you. We've used it for many years. Thank you very much. I appreciate you. Members should know that once spending money is must what appreciate and patronize maximum. Thank you and God bless. He has proposed to us another concept, another business model. We don't know what he's going to do, and I know it's going to be better. It's going to add more value to the ICF conference. Thank you and God bless you. Round of applause. Keep appreciating him, please. Keep appreciating him. All right, keep appreciating him. Okay. All right. It's about time we go for fashion parade, please. I don't know if you are ready.
defending the audience of the national chairman and the MP of Slogan with invited guests to open the dance floor. DJ, please give the befitting flavor song. DJ.
All right, DJ. We want us to start opening the dance floor. Find a special song. A special song. Go back to old school.
We'll take the mini fashion parade. Who wore it best? It is Afrikana night. We need volunteers to come and showcase their Afrikana outfits. African-based outfits. The audience will vote for the winners. We're going to do that in 5 minutes.
Okay.
In the mini contest, who wore it best? It's Afrikana night. If you know you're dressed like an African, please come off stage to display. There are gifts to be won.
Alright, I can see my first contestant. They are coming right front. Where is the second person? I can see the second person coming out.
DJ soft music, very soft. Now so.
Okay. My best contestant is coming. The second person is coming out. They are looking very lovely. Afrikana night. Okay. We're taking them live at the walk. Yes, they are looking very lovely tonight. Actually, we can show for us first, and they will dance. They will dance. They will catwalk and dance. You will catwalk and dance. DJ, find this Celine Dion song. Any Celine Dion song, let them catwalk first, and they will dance. Who will win the best person? We'll dance two songs here. We'll dance one highlight and then one hip hop. DJ, find this Celine Dion song.
They are going to be judged only on their outfits.
Let them are still coming.
Is there a guy coming up?
I need a guy. You see my DJ, hold on. Let the manager ask for first.
Another is here.
People are still coming up. After the catwalk, we will dance. That's a gift, right? Oh, you have a gift.
For dressing.
For dressing. Okay, for dressing. Okay. For dressing. I'm going to drop on this side. Thank you. All right. They are still coming up.
That's what I'm talking about. The only man in the midst of babes.
Yes. Okay. DJ, give me that Celine Dion. So see how we do it tonight.
Oh, there's another guy coming up.
That's it. Much catwalking and more dance. We enjoy tonight. You just walk to us, go down and then come back to your share. Come back to your line. So we'll go towards that, go down, then we'll come back. So we'll judge. DJ, I ready for me with this Celine Dion. Just no, after the catwalk, then we'll dance African song. Yes, let's use that walk. Yes, let's walk. Let's walk, let's see you walk. That you will start from this side. You reach that side, come back.
Isn't she beautiful? That's the African way. I appreciate that.
Back to back.
We beat. No, they're not coming back.
Next person.
Next contestant, Afrikana. She has a front on African leg. Even she beauty. But she's talking.
That is God, though. That is God, though.
She's beautiful. An African way. In an African style. Check out the lady first. Contestant number 3.
Next person. Yeah, go down to Africa. a sweet song. Find me old song, old school. Let's go back to the old school.
No. No, I'll be just supposed to arrest it.
Okay, that's it.
The dance competition is different.
Okay. Let's walk from so that we see them and judge.
Yes, no, please, let me
Let me please no sound. The ladies first. Men at the back, please. Thank you. Okay, this church will put us in trouble now. This church is not trouble. Yeah, you don't need for trouble now.
I will take you. I will take you.
Okay, if you know you want her to stay, you say what? Pharmacy. If you know you want her to go, you say what?
Nature field. Nature field.
Okay, if you want her to stay, you say what?
Nature field.
And if you want her to go, you say what? Pharmacy. You go this one now. No! Okay, if you want her to stay, you say what?
Nature field.
And if you want her to go, you say what?
Don't say anything.
Go. Are you ready for me? I will start by, let's start here, please. Stay on nation field. Stay on nation field. Go. Okay. Thank you for banking with
Please, I
us.
appreciate that.
Okay, thank you for banking with us. Stay. Stay on nation field. Stay on. Well, thank you for banking with us.
Thank you so very much. I appreciate that.
Thank you, appreciate that.
Keep working.
Stay on. Stay on. Let me go this side. Follow my brother. Follow my brother. Stay on. Stay on. Let me go this side. You see how? Let me don't listen to
Afrikana night.
Stay on. Stay on.
Is it nature field or
Nation field or no? Okay.
Please, can we appreciate this
Okay,
beautiful
sir.
African queen? Thank you so much.
Go or stay. Nation field or no? Okay, listen. Is that three? Stay or nation field? Go or nation field? Mommy, thank you for acting with us.
Thank you so much.
Three.
The one is beauty, then the men should come forward.
It's better, let's finish here. Okay, we'll change them now. If you want him to stay, say Odogu. If you want him to go, say away. Stay Odogu. Stay. Thank you, sir. Odogu away. Thank you, sir.
Odogu.
Odogu away. What's this, sir? Mommy, there is trouble.
This one has it.
That I tell you, say that the judgment will have.
Mama, show me.
Mommy, tell you should come, please. Come to the front. Where did they see you people? Where did they see you people? This one will have.
Mama, show me, please.
This one will have. Who go dance? Who don't go dance? We are not moving to confessional conference now.
Mama, show me.
Huh? Passion, another passion parade. Okay. Another passion parade. You said another passion parade. Dance. 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 No dance now. People wey dey dance different. DJ, find me another cultural dance wey we go use do another catwalk. This one another style. People wey go dance are different. DJ, find me another song, another old school song wey we use catwalk. Old school. We go repeat the catwalk with another style. Don't do the one wey you don do before. Change another one. What would they for small beginning? They say change your style, yeah? Another style, yeah? Be like that, so I go like that. Hurry. Did you ready for me? Let's go, no time. You want me to twerk? No, DJ, no. They don't go twerk. Church and rice, don't give twerk. They don't be small again. They don't be small again. No, they don't go twerk. Okay, no. When I open up, fine. If not African play, give me African play. You are one African play. Any another song, shuffle in no time. What is asking of you? Church and rice. 1, 2.
PSN to come and present gifts to this Afrikana team dressed contestants. All of them are winners. They are the best dressed.
You want you the winners?
Yes, everybody's a winner here. This is African team.
Okay.
We want to encourage Afro dressing. Afrikana dance.
Round of applause for them. Applause. Round of applause for them. It seems like when they want to show everybody love, don't need men who are not pass that one. They want to show everybody love. Yeah, congrats. Did they find me once for interlude song where they present something for them?
Alright, good evening. I think so far so good. Be a big art.
Yes.
I really like the idea that these women are old, they are beautiful, and they are showcasing the excellence of Africa. So thank you. Congratulations.
Thank you. Thank you. Thank you.
And you can see that the men are not left behind. I'm particularly impressed by their dressing. I'm impressed by Alago. This is typical river dress. Myself, I have 2 46 in my house with a river man as well. So congratulations.
Ologo Barama. Yes.
Congratulations.
Alaji 1,500. Thank you. Round of applause. Appreciate them, please. Appreciate them, please. Not easy. Round of applause for them. Round of applause for them.
Thank you so very much. We're going to take testimonials from 5 volunteers. Those who have used texture-filled products and they have given them results. They will each speak for 1 minute. 5 volunteers. Come and tell us, have you used Umbra? Have you used Gives Desire? What are the results? That is the tradition here during this Afrikana dance. 5 volunteers. Any volunteer from this side?
If you know you have used our products,
Please no, 5 volunteers. We have one already. Any volunteer?
I come front. If you know you have used our products, I want to testify that our product is good. Come from, please. We need 5 here and 5 the other side.
No, that's fine.
Only 5. I can see some hand. Come on, brother.
No, there are 3 already.
Okay, there are 3.
So we need 2 more.
They're already coming.
The first 5 to get to the stage.
Okay, the first 5 to get to the stage. Yes, it seems like they are 6. And they are 6. Let's take the 6. Should we take the 6 for the 5? Welcome, sir.
5.
Okay, the 5.
We should do the 10 at home. Okay, the MD has spoken. 10. So we need 4 more.
Okay, we've already the 10 at home, so we need 4 more. If you know you are this and product once, I want to testify. Let's run the 10 once. Yes, let's run the 10 once. We have 8 here. We have 9. We have 4. And we're running down. Okay.
So each going to speak for just 1 minute. Okay, that's it.
9. We're not here.
Madam, are you coming up? Are you coming up?
No.
1 more volunteer, please.
1 more volunteer, please. 1 more volunteer, please.
So they are going to speak for 1 minute. Tell us the product you used and the amazing results you got. Thank you. Introduce yourself, your state. Only 1 minute. The name of the pharmacy.
All right. Thank you very much, organizers of this program. Let you feel. Is Imo. Yes, I didn't remember is my name. Far is Imo. I just want to say this one thing about Nature Field Road. It has a very wonderful aesthetics, and personally, I've used it in so many of my patients and recommended them. But there are 2 products I want to talk about today that's given me very good results. One is cardiovite that contains garlic, resveratrol, and alpha-lipoic acid. For most patients who are hypertensive, try cardiovite to get very good results. I just want to say this, that personally, I use cardiovite every day of my life, and the results have been very wonderful. Then the other is the L&K. I learned about this product when it was called liver and kidney function. And I started using that product at that particular point in time. And recently I learned that the same product has been changed for one reason or the other by NAFDAC. Now labeled L and K. For most of the patients who you may want to get results that have any form of renal impairment or kidney impairment, I bet you have the best results using L and K. Thank you very much.
Thank you so very much. Let's appreciate it. 1 minute, ma'am. Your name, your state.
Good evening, everyone. My name is Chibuzo Chidebe. I came from my house. My pharmacy name is Mon Chidebe Pharmacy. But I'm the one that brought the red nature school to my house. Because where I said I was using it, I was prescribing it. I made the red again. And since then, all the customers have been giving they love it. It works. For myself, I've used it more. That is what I use for all my when I was giving birth. And I have recently there was some problem. So I now do IFEADIGO for 3 months. Now I don't use my meat. So nature's new products are very good.
She used IFEADIGO for 3 months and her eyes are better. Thank you. Thank you so much.
complained about their stuff down there. And this particular patient, there's Hollywood actress, but they actually came. I gave him the prostate test after complaining. He said he went to the hospital. And he was just complaining about his prostate, like his manhood. And I thought, okay, there is prostate test, let him use it. Funny enough, let me not just say magically. It came like 3 days later. It was like that product really worked. Like it felt so different. And said, okay, he wants more. Because I actually just gave him a sachet, let him use first. Then let him see how it goes. And then, but he said, okay, he wants more. I said, okay, let him get the pack. So they just feel, thank you so much.
Thank you so much. Good evening, all. My name is Joseph from Afrikana. I want to describe the effectiveness of natural vitamin E on prostate defense. I use the prostate to manage a patient with a PSA of above 10. And I placed a man on that prostate defense. Within 1 month, the man used it. He came back and sent me to go and run a test. He repeated that PSA test and the result was below 4. Another instance is vitamin E. I've used vitamin E on a patient that has skin disease, and when she used it for 3 months, the skin was glowing. And also, I have used it on a patient that complained of irregularity. And after using it for 1 month, she came back with a regular menstruation cycle. Thank you, Thank you so much.
Because I've had the patients that always want the pharmacy to buy and then now whatever the one is around, I'm not going to do people. So one day I used the contract with you, said that this is not people who you know have down. That is something I say what you see, how you come out. Why taking the contract for like 80 days? You want to get back and tell me that is fully restored. I want to also testify on the ICAP, lecture field ICAP. I had a very senior government colleague of mine who had a very serious eyesight problem. She has gone for surgery for eye correction surgery more than 2 times. I told her that she should try the ICAP. She should try taking the ICAP for like 60 days and see whether the eyesight problem will not be corrected. And she's doing it today. She's not going to surgery. She's not going to work today. She just got a normal eye checkup and the glasses she can do with it. Thank you very much. Thank you.
Good evening, all. I'm Pharmacist Isaac on my practice in National Hospital. I also really for products from nature field and I'm actually used, but just to stress prostate defense. I have this patient has an PSA was actually high and has been placed on tamsulosin with other medications. And he confided in me that he hardly meets his wife. So I placed him on prostate defense, knowing fully well the actual symptoms that he contains. Then within two months, he went for the PSA test. It was better. He had a good result. He was not happy with the family. Again, I want to mention joint renewal. I have used in so many arthritic patients and patients that normally come down with pains. Mostly women are lost too much calcium due to childbirth. Considering the effect of glucosamine on diabetic patients, I'll make sure the patients are abused and those ones that are not diabetic, and it has really good results. I have other ranges of products of nature food that I always use And what I can say here is that the products are reliable, a product you can use, and you rest assured that in the nearest possible time, you achieve the outcome. Thank you.
Thank you so very much.
Thank you.
Good evening, all. My name is Luke Buckingham from Rivers, MP Bosom Pharmacy, Bosom Hospital, and Bosom Gymnasium. Now, the issue is that I have so many people that will talk only on my 6,000. I personally use it, and seriously, the only proof is still assuming we have organized a pharmacy. So you can see the output of what my 6,000 upon. Even though I don't have fully 6 packs, but at least I have it. Thank you so much. So on the clients that have been wasted, those that have been suffering from severe diabetes and are wasted, and those that are doing gymnasium, they are taking it for muscle building, it's working wonders. So I'm minus 6,000. Nature of you, thank you.
Thank you so very much.
Thank you, my name is sir. Thank you.
Good evening, everyone. My name is Ifeadiago. I practice in Niger State. I will speak on calm night. In the world that is so stressful, we are under family pressure, we are under society pressure, pressure from the workplace. But with calm night, has distinguished itself among other drugs, and they use diazepam, exosan, that has addictive effect. But for calm night, you are sure that you can continue to take it and nothing will happen to you. But you have a holistic stick. Also interest you to know that some people before presentation take this calm night. If I don't have stage fright, they will be calm to do their presentation. Thank you, Nation Field, for what you are doing.
So much.
Good evening. My name is Pharmacist Fabi from Osun State. Alright, now we share the 2 lines looking at Acpn for business. I had a patient who is also a patient family member. He has diabetes. We start managing it. Give me anti-diabetic drug. So anti-diabetic good results. So he got in time. He started complaining that he's weak, and he also needs nutritional support. So he told me to every supplement in my body. So and I think that no, I have no dangerous people to go to be very good. So I reduced diabetic support. I placed it in it and started taking it. And after taking it, in no time, he told me that everything that told me of except what is complete, everything that is happy, that he really loved the supplement and he worked very fine. Thank you,
Thank you very much.
Thank you so very much. We take the presentation.
Okay.
Documentary.
I'm going straight to documentary.
We have questions and answers, and the winners will get gifts.
Okay. Yes, and I want to give a school. I want to give exam malpractice to some of my men that are both 60 years old. If you know you are both 60 years old, I don't have urges for, for woman and man thing, for night vigil. You don't always have appetite for night vigil. And you want to be having an appetite for night vigil. My brother, go for men's zone. Men's zone. It will give you strength and appetite to do night vigil. Once you are above 60 years, this one is very okay. I know some of my men will try to use that. It's very okay. And I have doctor, the one for guys like me that is below 40 years. You don't always have strength to do boy and girl thing, and you want to. You like to do. But you don't get strength to do, my brother, you try doctor. It will give you strength and appetite to do. Alright, so some of my ladies there out there, some of my fine girls, we don't get strength, we don't get appetite to do. And you want to follow do. And you're hungry you to do. And you want to do. call them Adam and Eve because we will help you do the do. So we will help do the do. DJ, find me Kukere while waiting for the commentary. Give me Kukere song, normal beats as it is. Give us like that. And also most of us remember this song. Remember the songs that we used to sing back in the days, weddings, when Nigeria is still good, when Nigeria is sweet. If you remember the song, let's go back to old school and remember the school days when we are back to school. And I got to start with me. Let me remember it for you. If you don't remember any song when you are back in the day, don't close up your hand, I will bring it back to you. You will sing. And it goes like this. If you knew, I know I'm going to go school now. I don't know pharmacy. If you knew in the waiting for you. If you knew what the walking up, the walking the hole. Who remember? What remember? Okay, I will watch your table. Let's know who people are attend secondary school and primary school together. Then they are a pharmacy. But once a student uniform will see the secretary to the school we go. All right now, until we know where you remember, I say that. Please make sure you have Samsung for the food and water, please. Don't forget. Make sure. Please, if the documentary is ready, it's not yet ready. Is it ready? Oh, it's not yet ready. It's all about time of questions and answer. Why you eat, and then we'll take question and answers. We'll take questions and answers.
Good evening, distinguished ladies and gentlemen. Welcome you once again to our Nature's Field Africana night. It's now a session for questions and answers. And like we always do, it runs through our brands. So we'll be randomly picking. If you know the answer to any of those questions, you may just kindly raise your hand, and I'll point to you. You come forward and give us the answer. Number one question. Name two of our Nature's Field products. Its profile for two Nature's Field products profile for beauty. If you know the answer, please raise your hand. I think Madam will raise her hand. Actually, this way. She was the first.
Okay. Hey, you're the girl down there.
Two of our Nature's Field products are for beauty. Nature's Field Beauty Show and Nature's Field Vitamin E. Vitamin E, one is correct, the other is partially correct.
They say one is correct, the other one is incorrect. Okay, partially.
Yes, partially.
She wants to add another one. Is it allowed?
I think we need to give room for another person, sir.
Okay. The other person.
Any other person?
Okay. All right. What do you want to say? He said she give us two. Is she correct? She has not completed her two.
Complete formula.
Will she repeat for another person?
Somebody else.
Somebody else. Okay.
Advanced collagen and beauty shop. Again,
please.
advanced collagen beauty shop.
Is she correct? I don't know.
I think we must give it to her. Beauty shop has different ranges. So we have beauty shop, hair, skin, and nails, and we also have the advanced collagen. So both are actually correct.
Okay, she's correct.
Yes.
Okay, is it the last one is correct, right?
And yes, the answer to two of the products are.
Okay.
Please, the second question. We'll go forward and we can answer the question.
Now, if you don't come and call your
Actually, you need to come to the other side.
Okay.
What is the Nature's Field brand used in the management of diabetes? Listen.
Okay.
Correct.
Okay, say, get a message there. Okay.
Okay.
Service completed. Start from nature center.
Okay.
No, start from nature field.
Nature field. Okay.
Fantastic. Let's give a round of applause.
And the purpose, please go and collect your gifts. I mean, there's gifts there, right? Okay, when they are done. Okay, next question.
The third question.
Yes.
Which of our brands is positioned for PCOS?
Okay. Okay. I see hand here first.
Okay, please go ahead. A round of applause for him. Thank you, sir.
Other members, please. Next question, please.
Next question. The fourth question. Name three of our newly launched industrial products. Three new arrivals.
Okay. We'll take from here.
Every cinnamon and capital 5 in 1. Are you hearing the last one, ma'am? Capital 5 in 1. Magnesia 5 in 1 complex, Ivory and cinnamon. She's very correct.
Correct. Round of applause, please. After the one, you take your gift. Yes, next question, please.
Our last question is, what is the strength of the collagen we have in our nature field joint review advanced pathway?
Ask the question again.
What is the strength, the concentration of collagen that we have in our nature field joint review advanced powder?
Okay. Understanding.
grams. No one.
Okay.
5,000 milligrams. Fantastic! Give round of applause for him.
5,000.
Yes, that's what we have.
Okay, that is our last question.
Yes, thank you very much. So all the winners come forward. We have a special gift for you.
All the winners, please come forward, please.
Pharmacists that answer the 5 questions, please come forward. Thank you.
All the winners, please come forward for your gifts, please. All the winners, please come forward for your gifts. DJ, give me one while they come up, please.
Thank you very much. We appreciate the knowledge you have about the background. Thank you so much. Thank you. Thank you.
All right.
On behalf of Nature's Field, I call on pharmacist Steve Obani to come and present the gifts to our winners today on our Q&A section. Please come forward, sir. Steve Obani.
Let's appreciate it, please.
A big round of applause for him.
Round of applause, please. Let's appreciate him as he comes forward, please. Stay is very nonsense. Thank you, DJ. Thank you. Thank you. Thank you. Thank you. Thank you. All right.
Thank you very much.
So we appreciate you. Thank you for coming. It is not easy to come visit and be with us. We are too. Right. DJ, give us more interlude while we go for the next segment. You know what we discussed then about the dancing competition? Baby, seriously fine. Ah! Maybe I'm asking that one to be for here. Seriously, when she want me to take water. When everyone asks me, when I bring one water here, bring water for my water, mommy, I'm good to go. It's not easy, it's not easy. Okay, we'll start dancing competition. Okay. Please, I want the ushers to give me 3 shares. Why my judges? Would they be here or would they be where they are? Okay, they'll be
Second judge, Pharmacist Ifeadiago FPSN.
Please get the share for my judges, please. Get a
Judge is Pharmacist Lizette Ezenekwe. The judges will score on energy, authenticity, and fun. Who is most entertaining, who has the energy, and who has authenticity.
Okay. The judges should make use of the front shares, right? Okay. Why they face the 3 judges, please. Let them come front, please. The 3 judges, let them provide them with pen, please. Pen and book.
We're going to dance in zones. The best dancers from each zone will be picked by the judges and they will participate in the grand finale.
DJ, you know how we channel it? You understand? You know how we channel it? You know how we picked the song to be? The 3 judges, please, let them sit down.
Northeast, North Central rather. Representative from Benue State, Kogi State, Kwara, Nasarawa, Niger, FCT and Plateau. Please, can we have representative from Benue, Kogi, Kwara, Nasarawa, Niger, FCT, and Plateau to take the first zonal dance.
Please, if you know they call your state or the place you base, please come forward, please. They should start coming up, please. Benue State, please. Where are they?
Kogi, if you don't have contestants from the North Central, we'll move. We don't want to take time. It means the North Central 0.
North
we'll
Central.
Go on to the Northeast. Okay.
North Central is coming.
North Central. Just Benue. Please, can we appreciate her?
Hand of applause for her, please. Appreciate her, please. Not easy. It's not easy.
Kogi, Kwara, Nasarawa.
Any
Niger,
representative?
FCT and Plateau.
Okay, she's coming. Hand of applause.
Judges, Miss Benue. Which state? Miss Niger. Is Kwara State here?
Miss Niger. Okay,
DJ.
Kwara State. DJ, are you ready? One song, as we said, 1 hip hop, then 1 tradition.
1 minute, just slow, DJ, please.
Just
Give
slow,
the
no time. 2 songs we'll be dancing. Let's go, no time.
Get ready.
Let's go.
Dance.
Go.
I swear I no go lie. The way you me feel forever you alive.
Sweet old school. Thank you. The final song. It is not easy. It is not easy.
Northeast, get ready. Adamawa, Bauchi, Borno, Gombe, Taraba, Yobe.
The Northeast, you get ready, please. If they are ready, let them start coming out, please.
They did not come.
Let's go.
Doro Bucci, Don Doro Bucci, Doro Jazzy, Doro Boss, Doro Big, you know say Doro Heavy, Doro Skiffle, you know say Doro Bloody, Doro that's the biggest rebel where you know of course. Doro push back anybody with Doro Miss, Doro Nana pass anybody for the gathering.
Thank you.
Thank you. Please appreciate them. It's not easy. Northeast, Adamawa, Bauchi, Borno, Gombe, Taraba, Yobe. If there's no one from Northeast, Northwest.
If no Northeast, let's go with Northwest, please.
Jigawa, Kaduna, Kano, Katsina, Kebbi, Sokoto, Zamfara. Jigawa, Kaduna, Kano, Katsina, Kebbi, Sokoto, Zamfara. Southeast.
Southeast.
Abia, Anambra, Ebonyi, Enugu, Imo. Southeast, Abia, Anambra, Ebonyi, Enugu, Imo states. Please keep appreciating them. Yes, so the PSN chairman of Abia State is stepping out.
A hand of applause for them, please.
Please keep clapping. Any rep from Anambra? Which states? Which state? Enugu. Anybody from Anambra? Ebonyi. Imo states. You're welcome, sir.
Daddy, you're welcome, sir. Welcome.
Abia is here. Enugu is here. Where is Anambra? The judges need to identify you by your states, please.
Anambra.
Okay.
Auntie, presenting. Imo.
Judges, Abia State, Enugu, Imo State, and then Anambra State. DJ, hit the dial.
DJ, let's go.
So
Don't do. But I don't kill my father for here.
Thank you so very much.
But I don't kill my papa for here.
Thank you. The judges have taken notes.
Judges is taking notes.
No. Okay, one more music, yes.
One more music,
one
DJ.
More music for 1 minute, please.
One more music, please. Let it complete.
One more, DJ.
DJ, one more music. Let it complete.
South, get ready.
DJ, thank you. Thank you. Hand of applause for them, please. Hand of applause. Put your hands together.
Please,
for
they say you
hands
should come
together.
back. The judges say you should come back.
Eh?
Please. Abia State. Identify yourself. Abia.
Okay, they want to. Abia. This is Abia State. Judges, are you seeing? Okay. This is what? Anambra. Anambra State. This Anambra State. This is what? Imo State. What? Enugu. So, thank you. Judges, you have taken notes.
Judges, are we okay?
You have taken the state. Okay, thank you. Thank you.
South.
South.
Akwa Ibom.
Akwa Ibom. Bayelsa. Cross River.
Crow River.
Okay, Crow River. You crow and you river. Delta.
Edo. Rivers. Where then they made a show. South.
Please start coming out. South.
Which state?
Which state?
River State.
River State is here. River State is here.
Which state? Akwa Ibom.
Akwa Ibom is here. Thank you.
Which state?
Huh? South. Which state? Delta is here.
Delta State.
Have you taken note? Delta.
So judges.
Which another state is coming? No, which state? Yeah, she's coming now.
Judges, we have Rivers, we have Delta, we have Akwa Ibom, and coming on stage is Edo State. Two times contestants.
There will be a problem this night.
Judges, are we okay?
Judges, you okay, Abi?
Are we okay?
Good to go. All right, DJ.
So please, no, let me repeat it again. Rivers, please raise your hand so the judges will see you.
Judges see you. Rivers.
Delta,
raise your hand.
Akwa
Ibom.
Edo. DJ, hit the dance.
Thank you. DJ, let's go.
Wicked producer. Feel the mama. You know I like it so.
Who's this?
Yeah, cherish you. I stand for you. I want to but I feel like for you. In the night, get up down for you. Get up down. We have talked to me.
Come on up,
DJ,
Thank you so very much. Thank you so much.
Thank you. Thank you for banking with us. Thank you. Southwest, thank you.
Ekiti.
Yes.
Lagos State. Ogun State. Ondo. The state of Osun. And Oyo State. Southwest.
Southwest.
Ekiti State. Lagos State. Ogun State. Ondo. The state of Osun. Oyo State. Please, can we come up quickly?
Southwest, please, where you? Well, now they now. Hey, now my men will go full here. Now men will go full this Southwest. Now men will go full on. All right, now men, I'll come to the stage, please.
Southwest, after the count of 3, we know saying only Tolu come up. Southwest go in.
All the whole Southwest, they fear.
Ekiti.
All the whole Southwest, now they fear.
Lagos.
Only one person, no.
Pharmacist Tolu, Lagos State.
Lagos. My judge is Lagos. We have Lagos now.
Ogun State.
Where Ogun boys now? Ogun men.
Ondo.
Where Ondo women?
State of Osun. Osun State.
Osun.
Oyo State.
Oyo State.
Ah.
They know they.
Kilo Lei or Kilo Day, which one? Let me know more that.
They know they. All right.
DJ.
DJ,
please.
Give us some. No, you go dance one song for us. You must dance for us. You go share some. DJ. Wow, Baba.
Oh, Baba. I wanna hold somebody. I wanna hurt somebody. Hold you for my hand. I'm gonna hold it for my yo 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 yo. It's not time for oh yeah, yeah 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 yeah. No 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 no. Oh yeah, make me alele alele alele. Yes I take go alele alele alele. I got to go alele alele alele.
Right, yes, number 2, 3, 3, 7. Yes, yes, sir. 4 is 4. 4. Oh no! Oh yeah. Samako gas, samako go, samako fia, samako fio, samiyala, samiyalo. Sadam no kayasa. Sadam no kayasa. Samako gas, samako go,
jíjó mi o, ẹ má jíjó mi o, ẹ má jíjó mi o, kẹ má lábẹ́ sí indó mi o, ẹ má jíjó mi o, ẹ má jíjó mi o, ẹ má jíjó mi o, kẹ má lábẹ́ sí indó mi o, aṣọ láti jọ mi o, ó láti jọ mi o, ẹ má jíjó mi o.
All right, thank you. DJ, thank you, thank
Judges,
you.
are you ready?
It's
Are
over
you
to you. Are
ready?
you
So
ready?
that we'll take the dance competitions at the final, the grand finale.
All right. Judges, it's over to you now. We'll give us what we have. Then we'll do the grand finale and know the final winner. Yes, they are coming to the stage.
Mademoiselle.
All right. Please appreciate them. Please, hand of applause, my judges. Please, it's not easy. Hand of applause, my judges. Please, it's not easy. Appreciate them, please. The confusion is too much. Did you on the background, please? On the background.
While the judges are working on their lists, we invite Pharmacist Yomi to come up so that we do the raffle draw for the consolation prizes. Raffle draw for the consolation prizes before the one for the car.
Until they get car.
They get moto. Moto car.
They get moto.
Moto car.
Now me go carry television, no need. May they not come.
Raffle draw for consolation prizes. While the judges are working.
Raffle draw, please. If raffle draw is ready, please let's confront for raffle draw while the judges put their heads together to give us the people for the final.
Okay. Nature's Field say while we're waiting, people should get up and dance and shake off the calories. DJ, bring this roof down. DJ, live band. Live band day and live band, please.
The stage man on set, please. The stage man on set.
DJ on point. Why the live
DJ,
band is getting ready?
I say whoa. The dance tonight to be on the live band.
I have a confession. Don't take it personal.
I've been my ass both Igbo, Hausa, and Yoruba song together.
I have a confession.
On the live set tonight.
Say I have a confession. So you gotta listen. See, I like Beyonce.
Please stay with
I like Nicki. I am Stika. I like Rihanna. She make me take Gaga. I like Kamotola. Cause people like her.
Man on set, please.
Not take. Put the car in the play. And money not take. Everybody run away.
Okay, DJ. Thank you.
Put the use to the play.
DJ Ice Water.
DJ Wave.
As the judges announce the winners from each geopolitical zone, the winners should come up stage for the grand finale, please.
Yes, thank you. You all danced well, and we, the judges, have decided. And for the North Central, Benue.
Benue, please come forward, Benue.
Please come forward.
Benue, please come forward. Hand of applause for her, please. Benue, come forward.
For Southeast.
For Northeast.
Southeast. There was no Northeast.
Okay, for Southeast, sorry.
South.
I will have Abia. For Southeast, we have Abia. Please come forward.
South.
South.
Delta,
please come forward. Delta, come forward, Delta.
And for Southwest.
Southwest.
It's Tolu.
It's Lagos, officially.
Congratulations.
Lagos, please come for hand of applause. My judges, please, hand of applause. Hand of applause.
Judges.
Please, if they call you a state you represent, please come forward, please, for our grand finale, please.
Please, can we keep clapping until they get to the
stage? Please, let's keep appreciating them till they come up here, please.
Abia, Delta, Lagos State.
See that there. Get the power. Get the power. Get the power.
First, second, and third.
See that there. Get shy. That there.
believe that my judges will still go to work again. Okay.
Ice water.
DJ, calm down. Mommy, we're going to go to traditional dance.
No.
Abi? We'll go hip hop. DJ,
you're going to play old school,
DJ, go.
hip hop, and then culture. So 2 minutes, 1 minute, please.
DJ, 1 minute, old school, any hip hop, and you go down to culture, we'll round up. So we can get first, second, third, and fourth.
First, second, and third.
First, second, third. The third person now, person we don't do it. All right, are you ready for me? DJ, are you ready? Let's go, no time. Say. I just Polindo. Child.
You see, baby dance, baby shake, yeah. I'm a hot duck, you know. Hallelujah, Hosanna, girl, you I want to. Kill your body, banana, sweet in my heart. When you dance, you the terror. You my love is forever. Want to sing you the Makosa, where your mama do, where your papa do, where your sister do, where your brother do. Come with the easy, come with the video. Baby, that's it, I say you do my music video. I say if not all I'm can't change it, can't change it. Mathematics can't solve it, can't solve it. Slap I cannot shoot it, but the DJ can slam it, so that me and you can dance it. I really, really like it. I like it. I really, really like it. Every day in a story, they never treat you like a lady. I wish I was a man. I wish I was a man. Maybe anytime you're lonely, can I be the one you calling? I hope you understand. Please take my hand and go with me. If you are my girl, I'll take you on the road. I'll take you places where you never ever been before. So give me Shabby, you know you can do me something. Shabby, you know you can make me go low. Suffer, shake your jingle. Let I suffer, shake my jungle. Your love took me by surprise. You can see it in my eyes. And I've come to realize it's a fact that I can't deny. Oh my. You can make me lose control. Baby, my kagiri, open the door. Show me the way. I say, krikata, kwari. I say, krikata, kwari. Baby, krikata, I say, open the door. Show me the way. I say, krikata, kwari. Baby, krikata, kwari. Krikata, kwari. I say, open the door. Show me the way. Be my African lady. My beautiful body. Ladies and gentlemen, it's possible for my body. Hello, with everybody for you. I did your fishing. Hello, that is someone.
DJ, thank you. You don't do. Hey, hand of applause, please appreciate them, please. Hand of applause for them is not easy. Hand of applause, hand of applause. The judges will be in very big soup this time around. Please, the raffle draw, if they are ready, please. The raffle draw should get ready. Men on set, please get ready. Set men, please get ready.
Please, can we appreciate it? You're not clapping.
Hand of applause for them, please.
Do you
Appreciate
know
them.
how old Abia contestant is?
Appreciate them, please. It's
and
not
he could
easy.
still dance like this.
Appreciate
all the grand finale competitors. Those that made it to the grand finale.
Okay, please.
While we
Set
wait,
men should get ready. Let's go down for 5 minutes, please.
while we wait for the result from the judges,
Yes.
and for the first set of raffle draw,
While we wait for the judges.
the band should please entertain us.
Set men, please. No time. Let's go to. Please, the raffle draw should get ready. Set men should go us on 5 minutes. Entertain us for 5 good minutes. Go around the world for 5 minutes, please. No time. Set men, please. Let's take it down. No time. Let's take it down, please. No time. No time. Okay. As we are waiting, it seems like my judges are ready. My amiable judges, they are ready. They are equal to the task tonight. Please. One, two. Thank you, sir. Seems like my judges are ready. We will take it down here. Why the set men, please, on the set, please.
Hello.
Hi.
Are we having fun this night?
Yes, sir.
I think it's great fun from every. Let's appreciate all the dancers. Everybody that came out. Let's
Hand of applause for them,
them.
please. It's not easy.
It's not easy. They've already defeated the rest of us that didn't come out. So they are all winners in that respect. So I will call the last 2 states and I will announce the winner. Then we will not all know who is the runners up. So Benue State, 57 points.
Hand of applause,
Let's
Benue
for them
State.
now. Then Lagos State, 59 points.
Delta says 50.
And the winner is Delta State. Delta, please come on dance with the judges. Oh. Delta, come oh. Delta, come and dance with the judges. Oh. 1 minute. Delta State.
All the 3 winners should come for,
and dance
please.
with IG Anuku. Oh. Delta, come. It's not me. It's 2 of you.
No.
It's 2 of you. You know I'm announcing.
You want to keep
so
on
it's 2 of you to. Please let them to give us 1 minute.
Okay.
The second position goes to Abia State.
The second position, Abia State.
Abia State. All right.
The third position, we have.
No, we've announced the 3rd position now.
Ooh.
3rd is Lagos, and then the 4th is Benue State.
Okay. The 3rd is Lagos. The 3rd is Lagos.
Lagos. And the
Okay,
4th
we
is
have
Benue.
Lagos, Abia, and then Delta, right? No. Yes. Let them come from for their gift, please. Let them come from for their gift.
Delta, 1st position. Abia, 2nd position. And then the 3rd position goes to Lagos State. Thank you.
Thank you. Thank you. Please, yes, confront, please. Confront. Yes, Daddy, confront. Let's take a picture. The photographer, please take them a sweet picture. Statement on set. Thank you. I can hear it. All right. They're supposed to have the gift while snapping. They're supposed to have the gift while snapping. Hey, there's someone to present the gift. Who? Hey, that's okay. Okay. You can go. No, you guys still can receive your gift. Yes. People are going to be here. Okay. Okay.
Yes.
Okay, please, we want to present them their gifts. Where is the okay? Awoma. MC. Okay, one night, our pharmacists, Asuli Kokwo, FPSN, FFIP, please come forward and the best dancers for this year's competition. Thank you, sir.
Round of applause for him.
He comes up.
Round of applause, sir. Thank you. The live band will give us 5 minutes hot dance.
Maybe if he wants to dance, maybe they upstage.
Okay, give me one special number. When I welcome my boss on the stage. One special number. Let's go. No time. All right. So these are the winners.
All right.
Hey, thank you. Yeah.
When I remember the goodness of God,
Lagos is done.
And the mercies upon my soul, the love and kindness upon my family, I feel like I can see my ghost. When I remember the goodness of God and the mercies upon my soul,
Ice water.
I think we all, as practitioners, have testimonies of the beauty of silken products. Nature field from the stables of silken has, through the pharmacy, touched the life of Nigerians. I know that pharmacists are multi-talented, multifaceted, but I never knew that we have this level of energy. On behalf of Silken, on behalf of Nature Field, the quality natural care, we present to you this beautiful gift. What did you do to the other people from Southwest? You didn't allow them to participate. Congratulations. While out there, I didn't appreciate. I'm sure you are above 50. Did you hear him? Did you hear him? He is above 67 years. Can we give it to him?
Can we appreciate the Abia State's BSN chairman?
On behalf
appreciation.
And for your, if I were the judges, if I were one of the judges, you certainly had a lot of impression from the table where I came from. You had a lot. We didn't even know your age. I was thinking you're 50 or thereabout. Congratulations. Congratulations. Our dear sister, I was also thinking whether you had some energy drink. On behalf of Silken, the quality natural care, present to you this beautiful, for all the energy, for all the style. I'm sure you had more to give. Congratulations.
Ice water. Thank you so much, sir. Thank you.
Thank you. Hand of applause. Sorry. Hand of applause, my guy. It's very easy. Thank you, sir.
Pharmacist Lizette, please stay back. Want you to pick the first prize. Pick the ticket for the first prize. Raffle consolation prizes. The immediate past national chairman of ACPN, Prince Adewale Oladigbolo, will give out these prizes. 6 consolation prizes, up of a microwave, a washing machine, a bedside refrigerator, a gas cooker, generator, and a chest freezer.
Please, if you are going, don't forget to have a raffle draw. Don't forget to have, how many things to be won here now, please. All right, let's go. Stage man, let's go, no time. Let's go down.
Kanyi kwa mwamba sai okechi abatombo obaya chikwe bube iye bube ogada gidi kanyi kwa mwamba okechi abatombo obaya chikwe bube iye bube abata biyo abatara baba gaga Ifeadigo, ikwere n'ime ụlọ m ya o mezuola nkwa ahụ kwere m ana m eti ya onye ọrụ ebube ụmụelu ụwa ibodo nwere nkwa Chukwu kwere ala Naịjirịa o nwere nkwa Chukwu kwere ọ dị ịdị ụtọ ibodo so na nkwa Chukwu kwere ogidi ibe bụ nkwa ọ so na nkwa Chukwu kwere ọ sị na anyị ga-abụ ndị mbụ na anyị agaghị abụ ndị ikpeazụ anyị ga-aga n'iru ọdịda bụghị maka ndị kwere anyị ga-adị ka osisi akụrụ na akụkụ mmiri nke na-amị mkpụrụ n'oge ya yanule ekwerekwe mewara m ya ekwerekwe mewara m ya o mewara m ya amịrị ji amaghị odogwu o mewara m ya ana m eti ya odogwu o mezuola nkwa o nwere amịrị ji amaghị odogwu o mezuola nkwa o nwere aga m eti ya onye ọrụ ebube ekele onye ga-ekwe bụ nkwa n'ụwa na omesie ya ka ọ ghara ịna m ekwe onye ga-ekwe bụ nkwa n'ụwa na omesie ya ka ọ ghara ịna m ekwe maka aka bi n'igwe ime woro m ihe tụrụ ụwa n'anya eze dị eze ime woro m ihe bara ụwa otibati bụrụ m ịkpa ngwangwa Jizọs ọbụbọ bụrụ m ụmụ n'ụwa Jizọs n'aka mụrụ ọbụbọ bụrụ m obi ngwangwa Jizọs n'aka mụrụ ọmụkwa ihe dị mma ana m eti ya odogwu na o mezuola nkwa ahụ kwere o mere ije amaghị odogwu o mezuola nkwa ahụ kwere ana m eti ya onye ọrụ ebube ekele ebube gị na-ejere ndị ngozi ebube gị na-akpara ụmụ gị aka ebube gị na-eme na-ekwesị ebube gị na-ekwu mkpụrụ obi ebube gị mara ọma ebube ibe ebube n'onwe gị Jizọs ọbụsisa ebube n'onwe gị ọtụtụ dị n'obibi ebe ọ bụ na ịbatara abatara Jizọs ebube n'onwe ezi ịnụ na ịbatara ọ ga-eme mkpọtụ gị a na ebube n'onwe
Thank you very much. Thank you. See as your voice
After the first set of drugs, we
voice.
can all get up and dance before
We will dance
star
tonight.
prize. So, the immediate past national chairman will pick the consolation prize for microwave. Consolation prize.
Please hold your ticket. If they call your ticket number, you come with it and you claim your prize. Sir, what is it?
The first consolation prize goes to Chisoram Ezeegu with ticket number 0762. Chisoram Ezeegu, ticket number 0762.
Pharmacy.
Hey, okay.
0662. Prospero.
Prospero Pharmacy.
Prospero Pharmacy, please, can we appreciate him?
Can we appreciate him? Okay, so hold this one. So where's the first? Yes. Yes. Prospero.
Congratulations. Microwave oven.
Microwave oven.
Yes.
So second one. Second one. They say I should close my eyes. So look at my hand. And my eyes are closed. My hands are closed.
This is for the washing machine.
I'll pick this one now. The second consolation prize goes to Gloria Osanam Maria Pharmacy with ticket number 0091. Maria. There's no state.
Is there a phone number?
So, Lagos State. Maria Pharmacy, Lagos State.
Lagos State.
Somebody should come and pick the second consolation.
Is the Lagos State chairman here?
On behalf of Maria Pharmacy.
CPC chairman, you're from Lagos State. You're the
please
IPC. Come and receive the second prize.
Second prize, Maria Pharmacy.
Washing machine.
Washing machine for the second prize.
Third prize for bedside fridge. Bedside refrigerator.
The third prize goes to ticket number 0363 from Toby Hallel Pharmacy. Lagos State, I think. Hallel. Is it Alec? Alec Pharmacy. Is it Alec? Pharmacist Toby. Phone number 080-698-10000. I think it's Lagos. Look at this, Lagos. No, it's Jos. I think it's Jos.
Third prize for bedside freezer.
Jos. Toby from Jos.
Any representative from Plateau State.
And this person bought product worth 604,510 naira. A round of applause for him.
Any rep from Plateau State. Fourth prize for gas cooker.
Please, can you write the price?
Gas cooker.
Can you write the second, third prize? Okay. So this fourth prize is for gas cooker, and we are doing it as fast as we could. Okay, so this one goes to Mohammed Yahya. Zamak Pharmacy with ticket number 0403. Mohammed Yahya, Zamak Pharmacy. Maiduguri. I think that's Maiduguri, right?
Maiduguri, Borno State.
Maiduguri, Borno State. Please write it at the back. Write it at the back, Mohammed Yahya. All right? So
the fifth consolation prize for generator.
Fifth one. Please remain hopeful. Don't go out. Remain very hopeful.
Generator.
I think the next sticker I'm picking belongs to somebody. That I can say confidently. And this last consolation prize goes to Pharmacist Paul with ticket number 0705. Overflow Pharmacy, Warri. Overflow Pharmacy, Warri. And this person bought product worth 617,250 naira. Pharmacist Paul, Overflow Pharmacy, Warri. Will somebody come and pick this ticket for? Are you here? Is that Pharmacist Paul? Please come.
Warri.
You want to pick for him? Please come. Warri, Delta State. Pharmacist Paul, Overflow Pharmacy. Please come. All right, so thank you. My work is done.
No, the sixth prize. This is
Sixth.
number 5.
Oh.
Sixth for chest freezer.
Sixth prize for chest freezer. The sixth prize for chest freezer. It could be yours. Somebody is going home with the chest freezer.
Could be you. It could be someone by your side.
Yes, so come and take this. Yes. And this prize goes to pharmacies, to Shop Medics Pharmacy, Lagos. Shop Medics Pharmacy, Lagos. Shop Medics Pharmacy, Lagos.
Lagos. Is he here? The Lagos State Chairman is here.
Shop Medics, Lagos. And this person brought product worth 600,000 naira. Apart from the profit he's making from nature feed products, is going on with a chest freezer. A round of applause for the winners.
Thank you so much. I think IPNC, you give out the prizes.
IPNC.
IPNC.
Okay. So give me now.
So first is microwave to Prospero. Where are MC there? Carry your tea. MC. We're not going to pay you your full money. Oh. Congratulations. Second prize, washing machine. Third prize, bedside freezer, fridge. This is Lagos State. Third prize. There's no gas cooker.
Oh, gas cooker. The next person, please.
Borno State is not there. Worry generator.
Hey, don't forget the gifts are real. The gifts are real. Yes.
So the band give us interlude for 5 minutes while the national chairman of ACPN will come and do the last set of draws. Dance for 5 minutes.
Band, let's go, please.
National chairman, please hold on. They want to bring the key to the SUV. Key to the SUV.
Mommy, could shop my own AC, I go carry me. And mommy, they'll give me AC, I mean plasma. I go carry.
The band.
The band, please. Stage man on.
Let's
Stage man,
see.
please. Uh-huh.
All right.
The band, please take us to another level. Thank you.
Where are the stage men, please?
Stage man, please. Let's go. No time.
Sure. Oh God.
Please don't forget to have another final raffle draw for the SUV. Yes, don't forget that. We have another raffle draw now for the SUV. Okay? Where you there? Okay, no time. Okay, where you doing now? Stage man, please. Let's go. No time.
All right, let's go see.
I can feel the glory upon me. It will be too good enough. Let's go. Hey. I can feel the glory upon me. It will make you good enough. I can't get enough. It will make you good enough. Abanana di masot, abanana maran, amabona kanchu kuzuru, iunanya chinekenduru. Amen, amen. It will make you good enough. Amen, amen. It will make you good enough. Ota onyamadu soyaga, onirechu kusumaga. It will make you good enough. I can't get enough. I can feel the glory upon me. It will make you good enough. I can't get enough. It will make you good enough. I can't get me to the moon. Abanana di masak, abanana maran, abona kanchu kuziru, iunanya chinekende. Amen, amen. It will make you good enough. 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 I can feel the blessings upon me. It will make you good enough. I can't get enough. It will make you good enough. I can't get enough. It will make you good enough. I can feel the blessings upon me. Oh, I can feel the glory upon me. It will make you good enough. Amen, amen. It will make you good enough. Amen, amen. It will make you good enough. Amen, amen. It will make you good enough. I can feel the glory upon me. It will make you good enough.
no buy anything. Hold on. The national chairman will pick the ticket for the second runner-up. Third position, AC. For the air conditioner, 1.5 horsepower. Chairman, no look, just pick. Thank you. Announce.
The winner is Mr. Chade. Number 20, Enugu Road in Suka. The pharmacy name is it Kunzi Pharmacy? Kunzi Pharmacy. Is he there? Is he here? Huh? Any person from Enugu? Enugu State Chair? From Enugu, yes, I can see somebody coming up.
Smart television.
And the next prize is from Dollar Pharmacy, Adu Gaba Innocent, Abuja. And the cost price of this gift is, you bought good worth 5 million. Or what? Yeah? You bought many tickets. Yeah. About 7 tickets. FCT, any person from FCT? Chairman of FCT, are you here? Dollar Pharmacy is the old lady. Can you begin to clap for Dollar Pharmacy? Congratulations. Is that now? Dollar Pharmacy is in Abuja. They won before. Yeah? Yeah? Are you Kinsey? This is Innocent Garuba. Congratulations, sir. Dollar Pharmacy. This is the first time I'm seeing you in the conference. Yeah? Yeah? You always attend conference? Okay. Congratulations. Okay, okay. Congratulations.
Congratulations, FCT. And for the grand prize, the star prize, we want to invite the MD of Naturefield, Silken Pharmacy, Naturefield, and pharmacist IG Anuku, IPNC, to come and witness the picking for the star prize, Nissan Rogue 2015 360-degree camera, full option.
Chineke na n'ezi nwaganya.
And can we call the past president of PSN, Azube Kokwo? Can we also call the chairman of Board of Fellow, which are Bakama Park Pharmacy, the chairman of opening ceremony, ably represented by IG, Inspector General of Police. To come and witness this is at the peak of the Afrikana night. A lot of us are playing now. Who is going to be the winner? The National Secretary should come up. Yeah. Past Chairman Foyibo, Dr. Ejiro Foyibo, can you come also to witness this? The National Secretary, are you there? No name. And the winner is this first. This pharmacy, LIWX, Lagos School Gate, Ibejuleki. From Lagos, Ibejuleki is in Lagos. The phone number is 080 60 243468. Huh?
Tolu, please.
Hello?
ọ bụrụ na chima kọndemụ gị ọ bụ onye ga-akọndemụ n'ụmụ okwu a na-akasị m obi
Hello? 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 Hello?
enwere m enyi
Hello? Is it from Kinsley? Peace Plus. Peace Plus Pharmacy. Okay, where are you now?
I'm at the Lagos now. I went for an appointment.
Okay, okay. Congratulations.
Thank you so much.
We just won a nature feed star prize. Nissan.
Hello?
Hello, can you hear me?
Hello?
Hello, can you hear me?
Yes, I'm hearing you.
I say in the Acpn National Conference at Afrikana night, nature feed Afrikana. Hello? National Conference
in Oka at Nature Field Africana Night. You just won a star prize of Sound Roll, Nissan Roll, SUV 2015 model. Congratulations. Congratulations. You can start coming Oka now to car. Coming to Oka to receive your car. You'll be there. You start a night, you fly, and fly tomorrow morning to come and receive your car, your star prize winner at the dinner. Congratulations to first prize. You are now a winner. You are hailing the voice of the national chairman and also the voice of the MP of the Afrikana night.
Hello, we congratulate you so much, Liz Pharmacy. Please take the next flight tomorrow morning and come and receive your star prize at the Acpn dinner tomorrow night, please.
Thank you so much,
Take the next flight and start coming to Oka.
India who Karamono Gamomo you woman. What did he chirimochi go one day one day? Gahu Paragi Mukazika Bonesia, anymore. Hallelujah, Kemu Kama. Agwaranga wana chukukaza mibiri. Hallelujah, Kemu Kama. Chineke siri muzo memo. Chineke siri muzo memo. Nabu cry sambe yimereni. Abu ya mere kako gichi wena. Onye kewere chiche noga chino wa. Onye wechi yoga keme ima. Agwara chuku kasa mipere.
My boss bless me.
Hallelujah, kemo kama. Agwara chuku kasa mipere. Enimo, hallelujah, kemo kama.
My boss. Dollar pharmacy.
Chineke ziri muzo memo mao. Chineke ziri muzo memo mao. Nabu cry sambe yimereni. Buya mere kako gichi wena. Onye kemere chiche noga chino wa. Onye wechi yamano keme ima. Agwara chuku kasa mipere. Hallelujah, kemo kama. Agwara chuku kasa mipere. Enimo, hallelujah, kemo kama.
Thank you, sir.
Thank you, Father. Thank you, Father. Thank you for saving my soul. Thank you, Father. Thank you, Father. Thank you for saving my soul. Now you, Jesus, see the butter my brain. Sugar my tea, oh, thank you. Now you, Papa, when they bless me, yabo. Mama, Papa, oh, you be blessed for me. Allah sanu, God save my soul. Jimmy Mela, God save my soul. Asangwa basi, Asangu, God save my soul. Eshe Baba, God save my soul.
Anything for your boy. Daddy bless me. Daddy bless me.
Father, to you be all the glory. Be all the honor. To you I say something. Father, receive adoration. Okore Chineke me. Ama nini eriji. Waya gbe mi ni eri ede. Ama nini ya kwa mwanya Chineke. Ini ya tone gerege. Ana bati takideri. See you worship me. See all the glory. An adoration that name above. To you. Only you, to you, the all the glory, and adoration and name Nagode Allah, Nagode Allah, Allah sariki. Nagode Allah, Allah nagode, Allah sariki.